We're a nonprofit organization where we wish to bring you leading edge information on how to make yourself more healthy and get on the path toward optimal wellness. We have online Zoom meetings at this point once a month, and maybe in the future we'll have in-person meetings, but for now we're doing it online. Today we have Dr. Peter Rogers. In 1985, he was a Stanford Student Athlete of the Year. In medical school and residency on his boards, he was in 99% in his scores. He did a fellowship at Harvard at Brigham and Women's Hospital in interventional radiology, especially with imaging guided surgery, and he emphasized vascular disease. And then in his neuroradiology fellowship at Rush, he pursued this further. He perceives himself as fat when he was in his 30s, and he's got some pictures to show it. And he lost all of his weight and kept it off for 16 years. That's a hard thing to do. He's an expert on vascular disease, brain disease, nutrition, cognitive optimization. He's a full-time neuroradiologist, but still does some interventional procedures. He also has a YouTube channel, and you can find out more about that at Peter Rogers, MD. So welcome, Dr. Rogers.
Thanks. Yeah, I was going to go over a little bit about stuff about optimizing cognitive function and some of my own personal experience and stuff that I think can help individuals and also help people for raising their kids. And then I'm going to go into more atherosclerosis, hypertension, and excital toxicity with regard to understanding it better helps us to prevent cognitive impairment and dementia. Okay, so first slide, can you see it? It should be like a drawing. Okay, so this is a drawing, and it's a comparison of the Tarahumara and the Pima. So the Tarahumara are in northern Mexico, Sierra Madre Mountains, Copper Canyon, and they were adjacent to the Pima in the past. In the Mexican-American War after 1848, the Pima got separated, and they now live in Arizona. And what's interesting about them is the Pima have sort of taken on an American standard American diet, the SAD diet, with a lot of junk food, a lot of processed food, a lot of fructose, and it's led to a lot of obesity. And so the drawing is characteristic of a lot of common surgeries that come from eating this type of diet for many years into middle age. Tremendously high number of gallstones that become symptomatic, cholecystitis, often treated with gallbladder resection called cholecystectomy. Also, that type of diet and lifestyle predisposes to, atherosclerosis of the coronary arteries. And here's the typical scars of a cabbage, coronary artery bypass graft. Right lower quadrant shows a scar for an appendectomy. Normally, fiber is a very important part of diet. You want to look at the most common nutrient deficiencies. They're fiber, potassium, and magnesium are some of the three most common nutrient deficiencies. They're up there. And the reason I mention appendectomy is fiber normally pulls water into the stool, makes it more liquefied. So you'll have liquefied stool on the right side of the colon. When the stool is dried out from a lack of fiber, there's an increased tendency for the stool to be dry and hard, and it'll obstruct. So the appendix hangs down like a little finger, and you can get a ball of stool that forms like a rock. It's called an appendicolith or a stool ball, a fecalith. It'll obstruct the appendix. The mucus glands from below continue to secrete their mucus, and then the appendix swells and it can perforate. That's appendicitis. So that's a common scar. Scar in the left lower quadrant, right down here in the left lower quadrant, that's a typical scar location for a sigmoid resection for treatment of diverticulitis. A lack of fiber in the diet, constipation, straining during a bowel movement, which increases abdominal pressure. There's a name for this constellation of findings. It's called abdominal pressure syndrome. The main person who described it was Dennis Burkitt, and he had noted a tremendous difference in the pattern of diseases amongst persons who ate traditional foods versus persons who were eating lots of refined flour and sugar and that type of diet. With his work, he was in charge of many hospitals for epidemiology in Africa back in the 1960s. So anyways, straining at the stool causes outpouching of the sigmoid colon. Those are called diverticuli or diverticulosis. If one of them pops, then stool leaks into the abdomen. The mesenteric sac. Okay, and then what happens is that will sometimes require surgical resection called a sigmoidectomy. In addition, that increased pressure, straining at the stool, constant constipation can cause the stomach to pop up into the chest, That's called hiatal hernia, associated with an increased incidence of gastroesophageal reflux. These are super common diseases. Any doctor in any hospital in America will see these diseases all day long, every day, and they all kind of go together. The straining at the stool also causes increased pressure down into the legs, and that increases the risk of varicose veins. Increased pressure downward into the veins around the rectum, so that causes increased hemorrhoids. Increased pressure downward into the veins of the scrotum, increased varicocele with risk of infertility. As a matter of fact, getting back to the hiatal hernia and gastroesophageal reflux, it used to be when I was a resident, most common type of cancer in the esophagus was squamous cell carcinoma, smoker drinker cancer. But nowadays, most common type of esophageal carcinoma is from reflux, and it's adenocarcinoma. So anyways, a lot of diabetes as well with that type of diet and lifestyle. And diabetics are the most common persons to get amputations. It's because, you got a smoker, they'll often get aortoiliac disease. You could bypass that. You could stent it. But when a diabetic gets microvascular disease down in the foot and the small arteries of the lower leg, infrapopliteal arteries, a lot of times there's nothing to bypass to, and they have to get an amputation. And so in comparison, the Tarahumara have sort of kept their traditional foods, and they're incredibly energetic. They're world famous ultramarathon runners, and people have gone out there to visit them. Famous American runners, ultramarathoners, and the Tarahumara, they can run a couple hundred miles. Like they've been known even to run 500 miles in 5 days. I'm not making this up. You'd see it. Nathan Pritikin was a big fan of them. Other people have studied them. The Tarahumara have extraordinary endurance feats, and it's sort of like part of they play a game where they kick a ball around and they run hundreds of miles once a year. So anyways, I just showed that's a contrast between a healthy traditional diet versus eating all this processed food and junk food and sweets and all this high fructose corn syrup. It really can make a tremendous difference in a person's health and energy. Okay, well, actually, I just got to do that. All right. So we talked about their location. Let's see if there's anything else. Oh yeah, there was a famous book written about the Tarahumara in 2009 by Christopher McDougall was his name, about running races with them. They have some big race they run every year too. Let's see what else. And they don't have hardly any hypertension, coronary artery disease, no obesity, average total cholesterol around 136. So anyway, I thought that was kind of interesting. It's a nice contrast. I'm going to show you a little bit about stuff from my own background because I'm going to talk about IQ and cognitive development. I hope this is interesting to you because I think a lot of people wonder, so many Americans are functioning very poorly cognitively. So many kids are messed up academically and intellectually. And I thought maybe this would help. This is my father on the far corner with the blue shirt. And these are his two brothers. One's a physicist, the other's a psychiatrist. They would come to our house and talk about books. And I was a young guy, and I would listen to them talking. I would try to join the conversation. The long-haired guy right here was very insulting. He routinely called me stupid. You're stupider than your father. And the relevance was I learned as a young guy, I need to read a bunch of books every time he's coming over and be ready to talk and argue, because he would read a book like on Saturday, come over on Sunday, and then expect everyone else to know what book he had just read, and then insult you and call you stupid. And it was a very aggressive conversation, but on the same time, as a young boy, it was built into my mind that part of being a man is you have to read books and argue about them. And I think that helped me a lot academically, because when I was an athlete, that was my main focus as a young guy, to be a wrestler. That's a picture of me sophomore year of high school. And I really didn't care about school in high school. But when I found that I still got recruited by Stanford after I got injured, the Big Ten schools, I had wanted to go to Iowa, but I hurt my shoulder. They wouldn't recruit me, but Stanford still took me. And that picture kind of sums up my life. I was always reading books to argue with my uncle and talk to my dad. My dad was real nice to me. And then I was training for wrestling. So Stanford still offered me a scholarship, even though I'm from Chicago. I took it, and I was kind of hoping that I could sort of reinvent myself, if you will, because I was really sad. My senior year, I couldn't make a big tournament from an injury. And what turned out to be interesting was I was way behind all the other kids at Stanford. I had never taken an AP class. I never heard of an AP class. My parents were both foreigners. They didn't know anything about the American academic system. So when I went there's all these kids, they've already finished the first year of college, 5s on their AP classes. I wasn't even in honors classes. But the fact that I had been reading and arguing with my dad and my uncle, I was very used to reading a book and to, defend my point of view on and summarizing the book, for example. And that, I think, really helped a lot. So I think the most important thing parents can do is get their kids to like reading. because even though I was way behind in everything else, I sort of sensed I had this strength from having done that really helped me out over there. And then this guy really helped me a lot too. These are the famous coaches of Stanford. This guy right here is Mark Schultz. Here he is wrestling Iowa, Ed Bannock. This is considered one of the most famous wrestling matches in the history of college wrestling. In the NCAA finals, Ed Bannock was a three-time NCAA champ, or two-time NCAA champ at that point, expecting to win his third. Mark Schultz from Oklahoma beat him. The Schultz brothers grew up in Palo Alto, right around Stanford. And this is over here after Mark won the victory. Is an incredible, like one of the greatest matches all time in college. Dave Schultz, that's him congratulating him. And Andre Metzger, these guys are all national champions. Dave and Mark are world and Olympic champions. I mentioned them because they really helped me out. I learned more from them than any of my professors at Stanford. Mark Schultz kind of taught me how do you build yourself up as an isolated, lonely individual with no connections. And he was incredible at doing that. And Dave Schultz, I'll show you a picture of Dave. This is Dave Schultz winning the Olympics against Martin Nasp, the German, in the finals of the Olympics here. Dave Schultz was a fat, dyslexic kid who got bullied a lot. And then he learned to wrestle and he became so good at it. He just was so obsessed about learning every little detail of technique. When I met him at the beginning of practice at Stanford for wrestling, he was fat. He was weak when we lifted weights. He was slow when we ran sprints. And I thought to myself, how does a guy who's fat, weak, and slow become a national champion and a world champion? And what I learned was because he's so obsessive about learning technique. You ask a typical college coach about how do you finish a single leg, he'll give you 3 methods. Mark Schultz would show you, Dave Schultz would show you 20, 30, 40 with every little nuance. And what I'm getting at is for an individual to pursue excellence in academics, a lot of times you can't just all of a sudden give yourself a high IQ, but you can meticulously get good at note taking, get good at absorbing information in class, at pre-reading, at study skills, and you can dramatically improve your ability to learn quickly and function cognitively. My first year, I was always afraid I was going to flunk out of classes. I got like B minuses my first quarters, but afterwards I would get A's and A pluses in the most difficult classes because I copied Dave Schultz's approach to wrestling and I applied it to academics and learning and later to other things in life. It's very helpful. I call it incrementalism, the idea of constantly learning every little detail, and you don't get much progress in a day or a week, but you do that every day and you make a lot of progress over time and you actually kind of silently pass other people and become really good. This was my roommate, national champion Dave Lee in wrestling, and there was our wall of fame. And we had a very clear-cut meritocracy. I was kind of low man on the totem pole for athletics compared to those guys. But that was a very good experience for me hanging around those wrestlers. Because in wrestling, there's no BS. And it's sort of like an engineering class, and you really have to develop. And it's very good for a person cognitively. There's no games were played. Some things about psychology of performance improvement. The other thing, too, that tremendously affects an individual's ability to perform is they have to have a worldview and a view of themselves in that world where they see themselves as progressively improving. And I've seen a lot of people who don't have a strong psychological worldview, and then when they have a disappointment, they can't bounce back from it. Whereas if you have a sense of this is super important and I belong in this field and this is my destiny, I must succeed. Even when you get knocked down and you fail, you bounce right back because you know you have to do it. You know, it's sort of like Hernan Cortez, you burned the boats and this is it. And it made a tremendous difference because I saw that at Stanford, all these fancy kids from these East Coast prep schools, most of them, you know, didn't get into med school and really didn't do that well. And there were all these kids, a little bit like me, you know, they sort of had fuzzy foreigner parents. They didn't know anybody. They didn't know anything, had no friends, and they just studied all the time and they did really well. Maxwell Maltz, I think, was great. He was a plastic surgeon from the 1960s who saw a tremendous difference in the outcomes of his patients. And the ones that had a strong psychology, like I must get better and get home to my kids or something, they would do great. Whereas these people who were sort of not focused, you know, the typical patient sitting there, oh, I'm in pain. I need something for my pain. Oh, I'm constipated. They won't get out of bed to walk. I'm in pain. And then they get a DVT, pulmonary embolism and whatnot. So anyways, Maxwell Maltz was read by all the best athletes at that time. And I myself also found him inspiring. In addition, the other thing I found helpful was the concept of the Bronski's psychology of personality disintegration and reintegration. The reason I'm going through all this is these are the mindsets that lead to national championship caliber achievement. And so I think it's a little bit worthwhile. Was Bronski's theory of personality disintegration and reintegration super popular with gifted students and gifted student programs. a person has to bounce back from failure and disappointment because it's inevitable that there's going to be some. And so what he talked about is you have to accept sort of a disintegration and loss of something you care about and be able to take your energy and refocus it into something else. So I was very sad that I went from being a great athlete to just being good. And I then sort of took all that energy and put it into academics. And that also applies to what can be described as an Alfred Adler inferiority complex, whereby a person is very sad and feels inferior in one way. Like I felt compared to all these national and world champion wrestlers I hung around with, I was like the wimpy guy instead of like in my high school being the best guy. And it was difficult psychologically, but I said, I'm going to make up for it. Even though I sort of screwed up my wrestling career with injuries, I'm going to become a great doctor or scientist. And just having that hope of a way to redevelop myself, I was so motivated. It's not even funny. As soon as I bounced out of bed in the morning, I'd study all day long. There was never a question of motivation. 12 hours of study. I didn't care because I see these other guys. They're like, oh, I had a big day Saturday. I studied 5 hours. And I'm like, what a wimp. That's nothing. And so having that worldview, that sense of hope for a better future, it created tremendous energy for achievement. And I've read similar things. I studied all these famous people who had great achievements and what was their thinking. And they often had something like that pushed them to work. Okay, exercise also makes people more intelligent. A lot of people who are athletes or at least exercise a lot, they function cognitively better and they maintain their cognitive function longer into life. Our brains are more designed for movement than they are for thinking. And that goes back to like Moravec's paradox, whereby the computer programmers could design a calculator to do calculus back in the 1950s, but they still can't design a robot to move like a human. Our cerebellum has about 70% of our brain neurons out of 100 billion. And you'd ask yourself, why does that tiny little cerebellum have so many neurons? It's because there's short interneurons that coordinate fine motion. And Voltaire had asked, why do animals have brains? Animals have brains because animals move. And what's the purpose of a brain? To walk down a path in a jungle, a forest, or a prairie and survive. Another good example of that is if you look at a sea squirt, in the juvenile phase, it's a tadpole, it swims around and has a brain. In the adult phase, it attaches to a rock and its brain is reabsorbed because it doesn't need to have a brain if it's just a filter feeder that never does anything. So the same thing that happens when you exercise of increasing glycogen storage in the muscles to increase your endurance for the next episode of exercise, it happens in the brain. The brain actually does store glycogen. New neurons are built. That's called neurogenesis, especially in the hippocampus, subventricular regions, and substantia nigra. And that's relevant, substantia nigra in particular, that Parkinson patients actually could do something to improve some neuronal function there. Neuroplasticity refers to the neuronal system has some plasticity. This wasn't widely recognized before about 1990. Then they started to realize, gee, there's a lot of things happening in the brain. That's how we can learn new things, of course. You can also form new mitochondria in the brain neurons. I think that's part of a student developing increased academic endurance, the ability to study not just 3 hours a day, but 5, 6, 7 or more. You form new blood vessels along the surface of the brain. It's called angiogenesis, new synapses, synaptogenesis. Excuse me. Frank Longo, MD, PhD, neurology professor at Stanford. He has a great video called Learning in Memory. It's about almost 2 hours long. Well, it's actually 2.5 hours, but right at the point, 1 hour and 51 minutes, there's a beautiful picture of the neurons stained with this green fluorescent stain, and you can see the neurons moving relative to each other, seeking connections. And to me, that represents the hunger for learning. That's how Frank Longo sees it. Well, if you're interested in the brain, it's like one of the most beautiful pictures you'll ever see of a brain. So Frank Longo at 151. It's a beautiful video. It's on YouTube. You can check it out. Okay, just a couple things about study skills. Another thing too is I see all these students, they go to college and they sort of fail at their academic goals. They're all disappointed. And to me, it's like they're quite willing to pay all this tuition money, but they haven't learned how to study. Study skills are not taught in grade school or high school. And very few students know how to study well. When I talk about studying well, it's like every kid in the class at Stanford is 99.9% SATs and all that stuff. So you have to be really good at learning and learning fast if you want to be able to do well in that type of environment. So I'm just showing here an outline format book I use for residency. So all the information will be in one spot, indexed to all the other books, and additional information added in. And I use that. I got like a perfect score. I was done in an hour and 10 minutes for a 4.5 hour test. And that's like the top 20% of medical students only getting the radiology. So I just show you that these types of techniques, they make all the difference. They basically increase your IQ. The other thing is walking around doing a self-test. What that means is you should walk around, put your books down. I'm actually walking around reading in this picture, but walking around and say everything back with the book closed. Because if you can repeat everything back, you've got it in your articulation centers, your hearing centers, and you're confident when you walk into a test that you can produce all the material. You're not just trying to recognize your highlighted notes, you can produce it all. So self-test and this outline format condensed notes, these are powerful study skills. This is just the next upper corner picture here is just making mnemonics. The picture in the bottom is this is called illustrated condensed notes. So take all of the illustrations and tape them into another book. This tremendously improves performance. For this, I use for my neuroradiology specialty boards, my CAQs, and it was incredibly helpful. I was told I did fantastic on that, but that was a useful trick. Illustrated condensed notes. These are sort of like a brain prosthesis. Another trick is everybody says they're busy. I got lots of doctor friends who never read a single book, and they always say, I'm too busy, I'm too busy. I read tons of my stuff just in the bathroom. I have a little portable table they put in front of the John for number 2. I always have a paperback for number 1s for voiding. And the point is you can learn a ton of stuff. I read at least a book a week in the bathroom just doing that. And I always put a difficult textbook on that table, something I want to force myself to read, like a biochemistry text, pathophysiology text. And so if one just incorporates these habits into their life, it's very easy to read a lot. I'll go through a couple books every week with these types of habits. Audiobook, don't get in the car unless you have an audiobook. And then I'll tape pictures to the wall in my bathroom. Of course, I got a separate bathroom from the wife. She considers this, disgrace. But anyways, these habits have really helped me a tremendous amount for learning stuff. Okay, here's that table. You can move it with your foot. And that was when I was taking neuroradiology boards, all the pictures around the wall. So, you take some regular student, and I've read a book, for example, I just recently read The Sorrows of Young Werther by Goethe. It was about this young guy totally in love with this girl, obsessing about her. It was written back, around 1800 or earlier than that. And so he'd write notes to his friend, Wilhelm. And the point was this. He was totally obsessed with this girl, everything about her, how she walks, how she talks, how she interacts with her siblings. And what I'm saying is, if he could have been that in love with biology as he was with this girl, he would be a fantastic student. So a student should also talk to themselves and say, someday I could be a biologist and I'll do all these wonderful things and I'll save all these people. I'll win a Nobel Prize or something. If they get them psyched up that way to learn, the brain memorizes what it believes is important. So you have to convince your brain that what you're studying is important. If you just study for a grade, you'll never achieve great academic achievement. This is called Leitner boxes, spaced interval repetition systems, whereby you only advance the flashcard to the subsequent box if it's automatic and easily, immediately recognized. Otherwise, it stays in the front box. And the point being is it gets you to spend more time on the difficult material because that takes longer to advance to the completion box. I actually wrote a book about all these study techniques and this stuff, straight A at Stanford on Harvard years ago. I ran cross country my senior year of high school as well because my shoulder was injured and I couldn't wrestle initially. And the reason I show this picture is I think running makes people smarter. These guys were the smartest students in the high school. They had the highest SAT scores. A couple of them had scored higher than me on the SAT test. And I've seen that also. I've heard other marathon runners, triathletes say that they've virtually never seen one of these runners ever become demented. The same determination that gets you to run that extra mile, it's very much like the one that gets you to have other good habits and to study more. So like if you had to pick a sport for your kid, I think running is one of the best sports. Tennis is good, golf too, the kids don't get hurt. They can do it all their life. Standardized tests, we won't talk too much about this, but basically they're designed that you have to already know the material. Otherwise there'll be too many questions. And if you prepare for them, you do great. If you don't prepare, you'll be disappointed. I've learned that it doesn't matter how smart you are or how good a student you are. You have to prepare for the individual test. So I took SAT 3 times and I kept doing better and better each time. If it was a fixed IQ test as it claims to sort of be, you couldn't do that because they always tell everybody you can't really change your score. It's completely untrue. You can make dramatic improvements in your score. And then for the MCAT, I figured I was like, I'm the best pre-med at Stanford at my time. I don't even need to study for MCAT. I considered it a waste of my time. I thought I was too good for it. And I scored lower on the MCAT than all my fraternity buddies. And it was kind of very embarrassing. And a standardized test for most people, you're going to some little podunk type place. It gives you a chance to compete on a fair playing field, so to speak, with people from big fancy places. So I learned to look forward to a standardized test as an opportunity in that sense. So that's my med school picture. I wrote a book on how to get top board scores. This is one of my mentors at a training course. You got to seek out mentors because somebody who's already achieved what you want to achieve can teach you so much faster. So anyways, I sought this guy out. He was a great interventional radiologist, went to his course in Michigan. Okay, that's a textbook I wrote in interventional radiology. And then here's my fat picture. In my mid-30s, I got fat. And it was because I was doing 2 fellowships simultaneously. I was trying to short track a fellowship and also do neurointerventional. It's like endovascular brain surgery simultaneous with neuroradiology. And I got to drinking 7 cups of coffee a day. I wrote a textbook that year. And so then I couldn't lose the weight for 3 years. And my sister-in-law, you know, she was making fun of me. She's like, well, if you know so much about nutrition, Mr. Doctor, why are you so fat? Because I thought I knew nutrition because it's considered as bundled in with biochemistry in med school. I had gotten like one of the highest scores in the United States, maybe the highest score on my med school boards. So I thought I knew nutrition, but I realized she's obviously right. I was fat for 3 years. And the good thing about that is that motivated me then. I knew to save my own life and not become fat diabetic, I had to learn everything about nutrition. So I made that my #1 priority in life at that time. And I just poured through all these nutrition books and went back to the biochem books and papers to try to really understand nutrition. Sleep, of course, makes you smarter. There's the glymphatic system, cleans the brain at night. It's like Victorian England when they empty their chamber pots out the window. The neurons can't go offline in the daytime because they're active. And so the neuronal milieu has to be maintained very precisely. But at night, the space around the neurons opens up and cerebral spinal fluid rinses over them. They pump out their waste products and it's washed away. And that's why you're smartest in the morning. Whatever you need to do technically, if you got to read some complicated book or paper, best time to do it's first thing right when you wake up in the morning. It's as smart as we get. And it makes sense too. If you think about an animal, when does an animal need to be smart? An animal needs to be smart when it's hungry in the morning, after it's fasted overnight. After a big dinner at night, might as well sleep. Okay, time management. You know, one of the things a young person especially should do, you get better at this as you get older. Every 30-minute increment, just analyze your entire day and get as much out of your time as you can. Don't waste any time, no TV, no nonsense. Basically, I look at it also as there's muscle activity, visceral activity, and cognitive activity. You can't do 2 mental things at the same time, but you can very easily do one of each at the same time. For example, if I'm eating dinner, no one else is home to talk to, I'll just walk around listening to an audiobook eating. So the walking is a little exercise. It lowers one's insulin. It improves insulin sensitivity. The visceral is the eating. And then the cognitive is listening to the audiobook. And again, just that little incremental habit of always getting a little reading whenever I can. You go through tons of books. Okay, it's also good, I mentioned, to seek out people. If you have a relationship with somebody, like my wife will want me to give her money to pay the bills, and I want time to just do the things I'm interested in. So it kind of works out that she's happy, I'm happy in that sense. What it takes to be a doctor, I don't need to go into that. That was something if I had time. And a couple just suggestions on raising kids. You know, I made all the mistakes as a parent and I learned from them. Parents should try to improve their diets before they even conceive the baby, because if a woman's eating a lot of junk food, she's at high risk to develop problems during the pregnancy, like diabetes of pregnancy or even hypertension of pregnancy. Check your prenatals. They're not all good. Some of them are not. I've talked to a lot of female doctors about this, and some of them will take them, some won't. And there's different brands of them that are maybe not as good as other brands. You'd be surprised about that. Okay, breastfeed as long as you can. That's a high priority, helps the kid's cognitive development. Try to get a second or third language going with the kid at birth, because once a kid can say no or starts having little friends to talk English to, they're not going to want to learn the second language. The best water you could get is to have well water in an area where there's no fracking. Test the well water first, of course, and then have a whole house carbon water filter and a kitchen reverse osmosis filter. I say this because there's so much stuff in tap water. You'd be amazed if you actually start studying it. There's lots of stuff in it you don't want to drink. If you want optimal health, you're going to want to improve that. At least have a whole house carbon filter. A little expensive. They're about $1,500. Kitchen reverse osmosis filters are also kind of expensive, about $600. But water is something you ingest every day, so you want to make sure you've got that one figured out. Children that do better intellectually is when the parents talk to the child a lot. That's the biggest variable for vocabulary, is that the parents spoke a lot with the child, and that you engage in a conversation with the child. Let them have their opinion, their thought, let them work through the problem rather than just sort of boss them around and don't talk to them. And I actually think perhaps the biggest thing a parent can do for a child's intellectual development is encourage them to love reading. It doesn't matter if the kid reads at 3 or 4 or 5 or 6. The important thing is that they like it. And it's real important that the child chooses the books. I think school ruins children's attitude towards reading because it forces them to read something a lot of times they don't like or they're not ready for. Like freshman year of high school is like when they're not ready to read Julius Caesar you know, things like Great Expectations. That's Charles Dickens' worst book. It's depressing. And so what I'm saying is most people in this country, they don't even read another book on their own freely the rest of their life. And they're basically functional illiterates. So in order for someone to learn, they have to enjoy reading, or at least be willing to read, because that's where the information is. You can learn a lot from internet videos, sure, but reading on one's own, and it's a tremendous brain booster for intellectual ability and function and vocabulary. I think the best, you know, if you want to try to have the child have perfect pitch hearing to make them a better musician, play classic music, adagios while they're young, like Bach, Mozart, Pachelbel, all that sort of stuff. And I think they're more likely to develop perfect pitch hearing. So yeah, it's good to be aware of this right when the kid's young. Otherwise, it's when you got that best chance. It's when they're developing their sound files to understand the English language, for example, and they get the sound files for, you know, second or third language. Best is to get it at that time so they can hear and say those things. Otherwise, they might never be developed into their brain. Piano, I think, is the best instrument to develop a child intellectually, and they'll learn not just the music, they'll learn also the history that goes with whatever time period those piano pieces come from and the country from which they arose. Vygotsky did good work on the zone of proximal development, scaffolding a child to developing skills. The parent shows the child how to do it, maybe helps them at first, and then the child can do it to follow. That's the zone of proximal development. I think drawing is like about the best hobby for a kid, because the kid can do it their whole life. Drawing, reading, piano, they're wonderful hobbies that develop the child in a positive way, and they can carry them through life. There's a lot of sports that are fun to play, but you can't play them when you get older. So, you know, it's not always the best investment in one's time. Of course, taking the kid to interesting places like the zoo. I would recommend only eating organic food. I've studied the biochemistry of the herbicides and pesticides in non-organic food. They're much worse than people realize. Also, one should be very careful. I recommend only eating whole foods with a single ingredient. MSG tastes good, so it's a flavor, and it gets put into tons of foods, and especially a younger child, they don't have as well developed a blood-brain barrier. It potentially might have a negative effect on their cognitive development. Aspartame also is an excitatory amino acid, as is glutamate, and it potentially could have a negative effect on a child's intellectual development. It's good if the parents can stay together, work together to help the kid. Sometimes in broken families, a lot of times is where trouble happens in terms of if there's no parent in the house, then the kids go over there and they get into mischief, smoking cigarettes and other things. I think the more you can educate your kid on your own, the better. Ayn Rand, even though some people might think she's a little crazy, she wrote an incredible essay on child development called Comprachicos, about how a child develops better when they are guided by older persons, the parents or older siblings or friends or relatives, in comparison when they're with a bunch of kids their own age, they don't develop. And I think she's right about that. It's an incredible essay if you're interested in child development. And then there's a lot of stuff they have to learn. For example, school puts tremendous emphasis on mathematics. Me personally, I'm a high-tech doctor. I don't use any mathematics. The only math I use, I learned it already in 4th grade. So I personally think it's kind of a waste of time to force everybody to learn calculus. You never use it. I never used it once in my life. So a lot of people think they're not smart because they don't do well in math, but learning all this history and this art and all this other stuff, I think that's more interesting and it has more relevance to regular life. So for what that's worth. I think also parents worry too much about, oh, I want my kid to make friends and learn social skills. Anybody can learn social skills. I've seen that the person who might be dumb in every other way will often have good social skills. So I would not worry so much about developing that. If they can get along with their family, that's good enough when they're young, and a little bit of social fine with their cousins and stuff, but it's overrated developing social skills by going to schools. And a lot of times they learn mischief from the kid's older brother. That's what I've seen happen. Things to read, kids should learn study skills. They should learn social skills. They should have good role models, especially in something they're interested in. That's how one, develops skill in those areas. It's good that they learn how to do stuff. Kids, right here is one of my kids building a birdhouse. Here's some of the pictures they drew. It's good for kids to learn how to, change the oil in a car, change the tires, all that kind of stuff. Physical skills, because a lot of times kids, they take Scantron tests in school and they don't have auto shop anymore. And the kids come out of high school, they really don't know anything. They memorize a list of vocabulary words that are meaningless. A lot of people, you ask them, what do you remember from high school being of any value? And a lot of times people say just not much more than typing is useful to them from what they learned in high school. As far as getting more exercise, here's some things I found helpful. I had a basketball court in the yard, put a wall up against it. We could hit tennis balls, and then the tennis balls would go in the neighbor's yard. So we put this big net on it. And that was a lot of fun. And that was my old house. And you could just play tennis in the backyard anytime. We had a pool. I timed the chlorine because I don't really like chlorine. I would time it so that it would peak in the middle of the night and then be low by the time we'd actually go in the pool. We had a lot of fun with that. I actually wish we kept that old house, because if your house has a lot of fun things for kids to do, then they'll stay there, and you know where the kid is. I used to like going out in the backyard to play basketball, get some exercise and some sunshine. And then we had a little other plaything for the kid in the back. And then here's what was the last straw on the camel's back. My kid, one day I came home from work and he said, "Dad, you're a bad parent." And I'm like, "Well, why do you say that?" He was in the 7th grade. He said, "Because you don't help me to play basketball. The other kids' dads help them to play basketball. You and mom just work all the time, and it's not fair." So it was, getting cold already towards winter, and I wanted to help the kid. And we never used our living room at that time for anything but storage. So I put in a basketball court in the living room, and the kid would play basketball. And I like playing basketball in the living room too. My wife went crazy though. She almost divorced me because of that. We ended up moving to another house because she was so pissed off about the indoor basketball court. But I thought it was a great thing. I regret leaving that house. So there was lots of opportunity to exercise. When you got a basketball court in your living room, it's easy to get a lot of exercise every day. So these are things that help a child to develop good mentors, coaches, friends, all that. If you're interested in that, read the biographies of all the famous people that you admire. That'll motivate you. They're high yield books. Okay. And then I wrote a book about how to raise IQ, and that was the thing from there. Other things too to watch out for, because a lot of kids they get head trauma from playing football and from soccer. We're going to go into atherosclerosis in just a moment here, but a little bit finish up on this cognitive development in people. Tons of people get cognitive development from soccer. That's not widely recognized. A lot of parents think they're doing a good thing having their kid play soccer, but if the kids are hitting the ball with their head, it's like being punched in the head. I've known kids that had to drop out of college for cognitive impairment from hitting soccer balls. It's kind of sad. Air pollution is a bigger deal than people realize. I actually think that's a problem with swimming. If you're inhaling all that chlorine all the time, I don't think that's good for cognitive development. Noise pollution is a big deal too. Kids need a quiet place to study. I like a quiet room with no music, but if you have to listen to music for studying, it should be just instrumental, classical music. I recommend don't give a kid a cell phone until as late as possible, and maybe limit their time with it, because it's like a child's IQ drops 20 points once they get that cell phone. All they care about is sending a text message to their friend and goofing off. I don't think you even need a TV in the house. Whatever you want, you can watch on a computer selectively. And it's important to be careful who a child hangs around with. Their friends shape their behavior. And even for you yourself, make sure you have at least some smart people you could talk to so you can have interesting conversations. And don't do jobs or summer jobs where you're exposed to toxic chemicals. Like a lot of painters get cognitive impairment. Nowadays, the paints are fast drying. It's not as bad, but still, you don't want the child working with chemicals or cleaning chemicals that are potentially neurotoxic. All of these things, cigarettes, alcohol, MJ, are bad for cognitive performance. Caffeine also, over the long term, is a negative thing. I know lots of doctors drink it, but it's not a good thing. It's a stress equivalent. We talk a little bit about fast food, MSG, aspartame, and all that stuff, and other types of water, and sleep deprivation being a problem. Okay, this is Rossetto effect. This is my family. My dad's from Ireland. My mom's from Puerto Rico. And what I noticed is in America, all the families are kind of, in our family, the problems, but everybody moves far apart, and the kids lose the benefit of knowing their cousins. Versus in Puerto Rico, everybody lives close and they all see each other and they all help each other out. So they're better off. I wish I could move to Puerto Rico, but it's too far away. Okay, now we're going to talk about atherosclerosis. Any questions or thoughts on that previous stuff? Okay, if we're talking about atherosclerosis, it's worth knowing because it's the most common cause of death. If you don't know about atherosclerosis, you're most likely going to die from it. It's number one cause of death. About 26% of deaths in the United States, myocardial infarction. And it doesn't have to be that way. There's counties in China where there's 0 deaths from atherosclerosis out of 260,000 people at autopsy. Next most common cause of death is cancer, and there's a lot of overlap in the risk factors. And there's a lot of other diseases that overlap in the risk factors. So it's good to know about these to help avoid them. So I think you got to learn about atherosclerosis if you want to stay healthy into middle age and old age. And you don't have to, it's not that complicated. Just avoid all the processed food and junk food and the excessive amounts of fructose, for example. We'll talk a little bit about hypertension, because hypertension is the number one risk factor for cerebral atherosclerosis and for having strokes. Not exactly the same as atherosclerosis, but it's a major cause of atherosclerosis, so it's quite important as well. And we'll talk about having hypertension and how one is at very high risk for dementia when they have hypertension. Okay, endothelial injury, we won't go into all this stuff. The important thing is, I think if a person's hypertensive, they should very quickly learn what they can about optimizing their blood pressure. And the big thing is sodium, lowering their dietary sodium. It's a major unrecognized cause of hypertension that's easily treatable. There's other things one can do as well, but that's a low-hanging fruit, if you will. First thing to understand about atherosclerosis and hypertension is the Windkessel effect. So the ascending thoracic aorta is like a second heart. When the left ventricle contracts, it pushes blood into the ascending thoracic aorta, which then stretches outward, it stores that energy, and then during diastole, when the left ventricle of the heart relaxes, the elastic recoil pushes inward, and that pushes the blood along to all the different tissues during diastole, the relaxation phase of the heart. What happens over time, if a person's chronically hypertensive, that ascending thoracic aorta is overstretched, and those elastic fibers become torn and they're no longer functional. They can't be replaced after a person's in their 20s, so that a person loses the elastic fiber function in their ascending thoracic aorta. And that's also why you see less diastolic hypertension after 50, because they've lost all their elastic fibers. And I see on CAT scan all these calcified aortas. That's a bad sign, because it predisposes them to lifelong systolic hypertension. And systolic hypertension is going to raise the pressure during the cardiac contraction phase of the cycle in order to maintain adequate blood flow to the brain. Real quick, here's an example of normal blood pressure. Let's say something like 110/70. Here's hypertension. We're in the ballpark here of about, very high systolic pressure. The top number is systolic. The lower number is diastolic. So this is 200/100. It's a very high blood pressure. The higher blood pressure will disrupt the pattern of flow. I'll have another picture in a moment to show blood flow patterns. Real quick about the anatomy of red blood cells. Typical red blood cells about 7 microns. It's sort of a biconcave disc. It's a bag of hemoglobin is what it essentially is. The hemoglobin binds oxygen and delivers it to the tissue. The capillary is a little bit smaller than a red blood cell. Typical capillary is about 5 microns. So the red blood cell has to fold back upon itself a little bit in order to get into the capillary. And so that will have relevance when, let's say a person eats a lot of vegetable oil. Those are bad. Those things like all those oils are bad. Corn, safflower, you name it. And they make the red blood cells sticky, and they stick them together, and then it becomes harder for the red blood cells when they're stuck to other red blood cells to pass through these capillaries. So pressure has to go up. So that's a major cause of hypertension. The spleen is like the graveyard for red blood cells. It has very tight sinusoids, like around 3 microns in diameter, so that our RBC that already is challenged to get through a 5 micron capillary, if it becomes old and stiff, they often become more glycated with age. They typically live about 120 days, and then they get caught up in the spleen by about 120 days. And then they're removed from the circulation. So that's an important point, that a red blood cell is more flexible when it's young, when it first comes out of the bone marrow. And that's the big secret of why women don't get myocardial infarctions until they become postmenopausal typically. I mean, there's some rare exceptions, like if a woman's 200 pounds overweight, substance abuser or something, she might have a myocardial infarction before 50, but you almost never hear about that because monthly menstruation is equivalent of a therapeutic phlebotomy. So she'll have a lower hematocrit, meaning fewer red blood cells in the blood, so her blood is thinner. That's going to tend to keep her blood pressure a little lower. Plus, in addition, she's got a higher percentage of immature red blood cells more recently coming out of the bone marrow to replace the ones she just menstruated away. So they're going to be more flexible as well. So that gives women this cardioprotective effect and helps explain why they're much less likely to have cardiovascular disease when they're premenopausal. And then it takes them a while. They'll catch up postmenopausal to men eventually. That's also a big part of why women tend to live a little longer than men do. Okay, this is just showing a peripheral smear. The vast majority of blood cells on a peripheral smear are red blood cells. And here's how they sediment out in a test tube. Okay, the higher the hematocrit, the higher the blood viscosity, meaning the thicker the blood. The thicker the blood, the higher the blood pressure is going to be. LDL cholesterol is one of the bridging molecules. There's other bridging molecules, of course, fibrinogen, uric acid, IgM antibodies. And what that's about is, this is a red blood cell right here, and it has a negative charge all around its outer surface. That negative charge is called a zeta potential, and it's due to there's glycoproteins on the outer surface of a red blood cell. It's called the glycocalyx. And the key thing is something called a sialic acid residue. The key point is it just has a negative charge. And because the other red blood cell has a negative charge, they repel each other. So that's what you want. You don't want the red blood cells sticking together for no reason. Bridging molecules are things that can stick them together and make them form clots. Okay. And if a person eats a lot amount of vegetable oil, they're going to get the red blood cells all sludging together. So this is just a picture of a sialic acid. The only thing that matters about it, it's really like a glucose with a carboxylic acid on. The key thing about it is that there's a negative charge on the deprotonated carboxylic acid, giving the red blood cell a negative charge. And the lining of the arteries also has its own zeta potential, largely from the heparin sulfates. The negative charges prevent the red blood cells from sticking to the lining of the artery called the endothelium. Here is red blood cells stuck together due to, let's say, vegetable oil or with acute infection with IgM antibodies. And that's called a rouleau formation because they stick together like a stack of coins. Rouleau means stack of coins in French. And of course, that makes it a lot harder for them to get through this capillary. Blood pressure has to go up. Normally, blood flow is like the side of your hand. If you look at a hand, the two fingers in the middle would be the red blood cells, and this would be the white blood cells, WBCs. And then if I put my thumbs right there on the outside, that's the plasma. And so it's going to have a parabolic velocity profile and laminar flow. It's relatively smooth flow with these lines of streaming cells, and that's good. When the pressure gets real high, you'll have an increased amount of turbulent flow. And I'll show the next picture is going to show what happens with that. You'll start to injure the wall of the artery and predispose it to thrombosis. Okay, so this is it, for example, in the common carotid artery right here in your neck. It bifurcates in the upper neck into the external carotid going to the face. Internal carotid goes to the brain. And this is where one of the earliest spots of atherosclerosis in the human body. It hits the median divider between the external carotid and internal carotid, and then it bounces off that. There'll be turbulent flow, and when turbulent flow is excessive due to, for example, a high peak systolic pressure, you're going to get activation of platelets. They become more sticky, more thrombotic, and these slow retrograde currents will have more time to sit on the wall of the artery. The endothelium, arterial lining, senses the abnormal blood flow patterns as being vascular injury, and it'll start to shed its antithrombotic glycocalyx and then express prothrombotic molecules on its cell surface. And with the slow flow from the retrograde currents, you'll start to form little clots. The initiating event, and believe me, there's a lot to know about atherosclerosis, but believe me, I've studied this for decades. I can tell you the initiating event is actually microthrombosis along the arterial wall. And this is called the atherothrombosis theory of atherosclerosis. I'm aware of the five different theories of atherosclerosis, but this is a useful concept. I look at these cerebral arteriograms every day, these CT arteriograms of the carotid artery, and almost always, initially you get a small clot right here on the outer surface of the internal carotid artery in the carotid bulb, and then it can progress from there. Typically, there's endothelial precursor cells that come along and they cover up the top of the initial thrombus, and they sort of prevent it from pieces from breaking off and embolizing. It's surprising how few emboli there are to the brain, given how common carotid artery atherosclerosis is. And also, the increased relevance of this picture and diagram is the same things happen in the coronary arteries. In the coronary arteries, there's just a lot more bifurcations. So this is happening much more in the coronary arteries. Coronary arteries are worse for atherosclerosis development. Okay, here's a diagram of an atherosclerotic plaque, and to some extent, this also shows the time course. Initially, there's an acute clot, which we rarely see because it's asymptomatic, and then endothelial precursor cells, they're made in the bone marrow, and they flow around, and they go and they cover up atherosclerotic plaques. That's been shown because you can form an atherosclerotic plaque in a prosthetic dialysis graft. If it were simply the normal native endothelium growing over the clot, you wouldn't be able to form that in a prosthetic graft. It's too far from the native endothelium and not continuous. They've also shown that in transplant patients. But anyways, you have endothelial precursor cells. The relevance of those endothelial precursor cells as well is that people have less of those as they get older. One of the biggest differences between an older person and a younger person is older person's more fragile. And that's why I'm a big believer, as a person gets older, they need to keep on improving their health habits if they haven't done so already, because they're more fragile, they're more vulnerable to atherosclerotic occlusion of their coronaries, of the arteries in their brain, and of other problems. Their immune system's a little weaker, they're more vulnerable to cancer and infections. But on the other hand, if they have optimal health habits, a lot of times people can be incredibly healthy. They've gone to Okinawa, for example, and looked at centenarians and seen people over 100 years of age, 105, with no medical problems, none. They sent American doctors over there, 2 Wilcox brothers. The good book on that is the Okinawa program, to work with the Japanese physicians. So the next thing one sees then is fibrous tissue within the clot. That gradually forms and takes over being the main component of an atherosclerotic plaque. There's also lipid core from the initial process, and there's necrotic material called the necrotic core. And the relevance is the immune system cells can come in there and they can remove the lipid, they can remove the necrotic tissue. So an atherosclerotic plaque does have the potential for partial reversal and reabsorption. You're not going to clear out all the fibrous tissue or the calcification, but it can shrink. In addition, when a person starts having a healthier diet and lifestyle, they can get renewed, improved function of their endothelial cells to produce more nitric oxide vasodilator. So there is the potential for significant improvement in coronary artery atherosclerosis, as well as in other locations in the body. Here's just a diagram of endothelial cells. They're kind of spindle shaped, and they're elongated along the long axis direction of blood flow. And that's also they have little mechanoreceptors, like little hair cells, that sense the flow. And so they can sense laminar flow. And that's what they want to see. That laminar flow keeps them releasing nitric oxide. So that's the ideal situation. Okay, this is just a little diagram about all the different things endothelial cells can do. The main thing is that they make nitric oxide. That's the most important thing from our point of view. The heparin sulfates right here with the negative charge in them, they also generate zeta potential for the endothelium to prevent thrombus forming on it. Atherosclerosis, though, is a lot more complicated than just cholesterol. There's much more to it than that. And it's also been the case that people can get atherosclerosis that are completely outside of all this cholesterol stuff. Sickle cell anemia, kids can get a myocardial infarction and a stroke just in childhood, okay? Elevated fibrinogen can cause vessels to thrombose. Fibrinogen is elevated by stress and all the stress equivalents. That includes caffeine, lack of sleep, inflammation. Elevated hematocrit can cause an artery to thrombose. Smokers will have a high hematocrit compensating for their hypoxia for the carbon monoxide from cigarettes. The bike riders from Tour de France bike riders who were using extra epotin that they shouldn't have been, got their hematocrit so high that some of them had myocardial infarctions, and that's in world-class athletes because they were getting their hematocrits up over 50. It's dangerous. Polyuria is just a disease where the hematocrit, the number of red blood cells is increased, and they're also prone to coronary artery occlusion, thrombosis, clotting off. We talked about turbulent flow hypertension. Excess sodium intake can cause hypertension. People have a splenectomy, they can't clear out the red blood cells. All of these things can cause atherosclerosis and coronary artery occlusion. When you get an active infection, the IgM antibodies have a lot of prongs on them, so to speak, that are positively charged. They'll grab the 2 red blood cells and stick them together. So that's why people with severe acute infections like sepsis, pancreatitis, infected pancreatitis, they're prone to thrombosing major blood vessels. Okay. Also, your blood is thinner when you're warm. I think that might be why some people like to retire to a warm area. I always like being warm. I'll have cats and hats and sweatsuits and stuff on in my house, and my family will tell me I'm hypothyroid, but I know I just feel better and I function better that way. These are some of the different theories of atherosclerosis, and I think each one plays some role. The vasovasorum theory is very interesting. It's mostly put forth by this cardiac surgeon named Axel Haverich. He wrote an interesting book about it, and it helps explain certain things. You can get an atherosclerotic occlusion of the vasovasorum, meaning the outer third layer of an artery. There's little blood vessels that travel through it. And if you infarct the center of the artery, the tunica media, you can then have a weakened arterial wall, and that can predispose to aneurysm formation. And that's interesting because it explains why the risk factors for an arterial aneurysm are about the same as the risk factors for atherosclerosis. So that's kind of an interesting theory. Then there's the bacterial theory of atherosclerosis, because I'll often find bacteria in atherosclerotic plaques, but I don't think that's that important, because even though I know they often find them, and there's some even cardiologists who really push that theory, people can reverse atherosclerosis and control it without having to do anything whatsoever for the bacteria. I think they're almost saprophytic. They go there because the clot's there. They help to, if you will, to eat the clot and remove it. I think that's what's happening, because they don't seem relevant for treatment from what I've read and what I've seen. Inflammatory theory, I'm familiar with that concept coming out of Harvard, especially the idea that elevated cholesterol and whatnot is part of the risk, things that make the blood hyper viscous, but that there's also an elevated inflammatory component. That's actually kind of controversial. And there's other people who say, gee, there's really not that much atherosclerosis when they look at it under a microscope. Pathologists have told me that. And they believe that CRP is a marker for a lack of glycogen storage in the muscle. It's functioning as a myokine, whereby the muscle is signaling that it's short on glycogen because of insulin resistance. And so that's a whole other area, and I don't want to go down that path too much, but just so you know, there's a lot of debate about that. Protective adaptation theory came out of Kenzie, a cardiologist, and Cho. And the main thing I got out of that was the idea that once you lose a Windkessel effect, your hypertension just tends to get worse, and you'll be more predisposed to endothelial injury from hypertension and progressive atherosclerosis. But my response would be one could especially lower their sodium and really improve control of their hypertension. And I think that's been shown pretty well. A lot of pathologists are proponents of the atherothrombosis theory for atherosclerosis. And we just talked about some of these things that lipid theory alone cannot explain a lot of issues in atherosclerosis. One thing I thought was interesting was hysterectomy. Hysterectomy greatly increases a woman's risk of atherosclerosis. As a matter of fact, if a woman has a hysterectomy before the age of 35, she basically becomes like a man in the sense that she no longer gets that protective therapeutic phlebotomy every month. And if she's not aware of atherosclerosis risk factors, and I think in general, from what I've seen, men are more scared of atherosclerosis than women are, because a guy, you know, he's heard of a friend who's become impotent in his 30s or 40s, and they say about 30% of men in their 30s are impotent, 40% in their 40s, 50% in their 50s, 60% in their 60s. So guys start knowing other guys who've been impotent, they start becoming scared. Plus, they've also heard of another guy who's had a myocardial infarction or died. So men start to become aware of that in their 30s or 40s. And they start getting a little scared about watching their atherosclerosis risk factors, whereas a lot of times I think women are not as, they're oblivious to it. So if a woman's had a hysterectomy and she's not aware that now she's at increased risk for atherosclerosis, I'll sometimes see that because I look at a lot of brains, I see demented patients, and I'm like, why is this woman demented? Usually a woman in early 50s is going to have a clean brain when I look at her brain MRI. And if I start seeing a bunch of little silent strokes, perivascular flare hyperintensities is what they're usually called on a brain MRI, I'll ask myself, why is this happening? And I'll try to figure it out. And a lot of times I'll see that there's no explanation. She's not a smoker. She's not a drinker. There's no obvious reason. She's not massively overweight. And it usually comes down to she had a hysterectomy, between 25 to 35 years of age. She became hypertensive and she got brain damage from that. So the hysterectomy is a big thing. Mayo Clinic did a study where they had like about 2,000 hysterectomy patients and saw that they have a markedly increased risk of early onset congestive heart failure, coronary artery disease. So that's just something good to be aware of. And I actually think I've had women come up to me and tell me every woman in their family had to get a hysterectomy when they were young for fibroids. And so then I guessed to myself, well, why are all these women getting hysterectomies for fibroids? And I actually think, there's multiple different risk factors that, but I think a lot of times it might be because they're all drinking tap water. There's a lot of estrogenics in the tap water.
Oma is listening, girls. Oma is listening to a live lecture that has to do with health.
Go ahead.
I don't quite understand. Is that a question?
No, it wasn't a question. It was somebody joining the group who was off mute.
Okay. Yeah. So anyway, I just thought it was interesting that, you try to understand why is a patient having problems. And that's just something that's not widely known, but it actually happens often enough that it's worth knowing that a hysterectomy increases a woman's atherosclerosis risk factor significantly. And I also think that it's too expensive for municipal water filtration to remove all the estrogenic chemicals. So I think it's important to get at least a carbon water filter on one's house water, because otherwise there's a lot of estrogenics in the water. Typical birth control pill, something like ethinyl estradiol, EE2. That doesn't necessarily all get removed. In addition, there's other estrogenics. There's herbicides like atrazine, highly estrogenic. It doesn't necessarily get fully removed. So you need a carbon filter. It's a carbon-based molecule and it will get removed by a carbon filter. So you would want that in there. Okay, let's see. Old people. What have I seen too about old people? Old people becoming more fragile. I like the painting by Thomas Cole. It's a beautiful painting. It's a series of paintings called The Voyage of Life. And what I've seen is some of these older guys, they'll have a relatively normal total cholesterol. Sometimes it's because they're on medications like the statin that's help controlling their total cholesterol, but they're just more fragile. Despite having relatively good cholesterol control, they're still getting quite sick. And I think some of it has to do with their sodium and they're hypertensive. But what I'm basically saying too is a lot of the old guys, I talk to them and they have this like c'est la vie attitude. I'll see these guys getting their foot amputated, going blind from complications of diabetes and whatnot. And I'll try to give them some helpful advice. And they kind of look at me like, oh, what are you going to do at my age? And I'm just like, you know, if you don't, you have to respond to your illness and do what you can to improve it. If you just accept it or say it's genetic, everybody in your family has diabetes and coronary artery disease, then you're never going to have a chance of getting better. So anyways, what I'm saying is a lot of times I've seen is young guys, it's hard to talk to them. And in my experience, they always think nutrition's a big joke and they want more protein to lift weights and get strong. So they don't listen to nutritional advice. But a middle-aged person with a receptive mind and wants to learn, they can often tremendously improve their health, lose all their obesity, and really improve their health tremendously. So that's the patient age group where I've seen the most success in working with them. But in any age group, if a person simply makes up their mind, they want to learn about these things, there's a lot they can do to improve. Okay, we'll talk a little bit about sodium. So sodium is positively charged ion, you know, in salt. Sodium chloride. Chloride is a negatively charged ion. Most of the processed food contains lots of sodium in this country, and most of the sodium that people eat in this country, in the United States, is from processed food. Typically, it's about 75% of their sodium intake. I would actually recommend to eat essentially zero processed food. You know, what exception would I make to that? If there's a single ingredient. I like foods where there's only one ingredient. When there's only one ingredient, that means they're not allowed to put MSG into it. And so I would say something like oatmeal. That's a good food despite being slightly processed, but it's one of the very few. If you start reading about MSG, monosodium glutamate and whatnot, and monosodium glutamate equivalents, MFGs, you know, manufactured free glutamate, they're in almost all the processed foods. It's very difficult to find a processed food that doesn't have that in there. So, and quite often, a lot of these processed foods have quite a bit of sodium. Normally, if you look at naturally occurring foods, they're going to have high potassium and low sodium. Processed foods, it's the opposite. You're going to have high sodium and low potassium, which is bad because sodium is a vasoconstrictor. It'll predispose to hypertension. Potassium is just the opposite. Potassium is a vasodilator, opens up the arteries. It'll predispose to keeping your arteries open and giving you a nice normal blood pressure. If all your arteries are tight, then pressure has to go up to pump through a tight arterial system to make sure that the brain's getting enough blood flow. William C. Roberts is a sort of famous cardiovascular pathologist. He's written a lot about atherosclerosis. He wrote an awesome paper. I think it's the best paper ever on coronary artery disease. It's called Quantitative Assessment of Coronary Artery Atherosclerosis at Necropsy, at Autopsy. But anyways, one of the things that Dr. Roberts said is that if babies are born with a blood pressure of around 90/60, and in populations where they don't add salt to their food, it'll stay 90/60 their entire life into their 70s and 80s, or even go down a tiny bit as they get older. Another good, interesting epidemiology population is Yanomamo in South America, who only eat about 200 milligrams of sodium a day, and they have virtually zero incidence of hypertension. Versus, you know, even the so-called low salt diet recommended to patients in this country is often about 2,000 milligrams a day of sodium. You know, that's like 10 times higher than the Yanomamo are eating. Other populations, that's been shown to be the case as well. Walter Kempner was a physician who ran a program of a rice diet in Durham, North Carolina, and he would sometimes have patients on as low as 50 milligrams a day. That's probably the minimal you could put a patient on, but he had very good results with his hypertensive patient back in the 1940s, 50s, and 60s with that. Sodium creeps up on you really quickly. Just one box of cereal with 200 milligrams per serving, 15 ounces, you got 3,000 milligrams of sodium right there, and there'll be some in the milk too, potentially. And I know that's a big deal, and I think they sometimes will put MSG in the cereals because I could eat a 15-ounce cereal box in 5 seconds versus if you try to eat a real food, you got to chew it and you got to work with it. It takes time. It doesn't just melt in your mouth and go down so fast. So the point I'm saying is a lot of people have very high sodiums. And my recommendation would be try to get that sodium down below 2,000 milligrams a day, and they'll have a better chance of controlling their high blood pressure and subsequently thus decreasing their risk of having a stroke and having progressive atherosclerosis in their coronaries as well, and also lower the risk of becoming impotent. Another thing that's of interest is the dietary ratio of potassium to sodium. if you look at naturally occurring foods, they're usually going to have like around 10 to 1 or even more, much more potassium than sodium. And you want to have at least in your overall diet, out of everything you eat altogether, a ratio of potassium to sodium of at least 5 to 1. Probably one of the best books I ever read about pathophysiology is this book called High Blood Pressure Solution. I tried to contact the author, a guy named Richard Moore. I think he's dead. You know, I wasn't able to contact him. He's really old. I mean, he did his fellowship like in his PhD in like the 1950s or something, but it's so brilliant in explaining mechanisms of hypertension. And basically what I could just say is make sure you're eating enough plant foods, P for plant, P for potassium, to get more potassium. Or even they had a thing in Finland where they switched out the sodium chloride salt for potassium chloride, and they had a dramatic decrease in cardiovascular events, coronary and stroke. All right, here's a picture that helps explain why it's so important to, you know, get adequate dietary potassium and not eat so much sodium. Every cell has a potassium sodium ATPase in its plasma membrane. Every cell has lots of these. This is basically the primary energy system of a plasma cell membrane in a cell. And what it does is it'll bring in 2 potassium, and that's why I put the K first. Sometimes you'll hear it in the other order, but I like to put whatever happens first, or whatever brings it into the cell. The potassium is being brought into the cell. K, by the way, comes for kalium. That's the Latin word for potassium. And the N for sodium comes from natrium. That's the Latin word for sodium. Okay, so a Kn ATPase, the K is coming into the cell, and it's about 2 potassium molecules, whereas 3 sodiums are being pushed out of the cell. And so the net effect is you're pushing out 3 positive charges, bringing in 2 positive, is over time, the inner part of the cell is going to become slightly negatively charged. Typical charge in a cell, let's just say for a neuron here, but let's just call it negative 65 millivolts. What's of interest here is that it requires ATP to run this pump. And the ATP is then converted to ADP, so it loses a phosphate. There's a magnesium drawn in here over the ATP because typically phosphates are very highly charged and they want to move away from each other. The magnesium with its positive charge can kind of hold those phosphates in place so they don't move away until the designated time as set by the pump or the enzyme that's relevant. But this is a really important thing, this Kn ATPase, because it helps set the resting membrane potential. I realize there's a little more to resting membrane potential than that, but that's the primary event that's going to determine resting membrane potential and the electrochemical gradients of the plasma membrane is the Kn ATPase. So now you've got all the sodium pumped out of the cell. So the sodium outside the plasma membrane of a cell, this is the plasma membrane here, this black line going around. The sodium really wants to come into the cell. It has an electrochemical gradient making it want to come into the cell. The electrical part of the gradient is the negative charge in the center of the cell. So having a positive charge on the sodium, it is attracted to the negative charge inside the cell. In addition, because there's a much higher concentration of sodium outside the cell, let's say about 140 versus about 14 is the relative amount inside the cell, it has a chemical gradient that also makes the sodium want to come into the cell. So there's a lot of kinetic energy in a sense of the sodium wanting to get into the cell. So now the cell has other jobs to do. And one of them is it wants to pump out calcium from its cytoplasm. Calcium, remember C for calcium and C for contraction, like in a smooth muscle cell. Calcium is like an on-off switch in a cell, and the cell has to maintain very tight regulation of calcium. So this is called the NACA exchanger. NACA is for Na for sodium, Ca for calcium, and exchanger means that it brings in sodium along its gradient and pumps out calcium. A lot of times it's abbreviated NCX. So this gradient having been established by the Kn ATPase, this is primary active transport. It's called active transport because an ATP had to be used to make it run. And then this is called secondary active transport because it's based on the gradient from this ATPase. There's a lot more of these than there are of these in a plasma membrane. And this enables a cell to very rapidly pump out calcium so it can tightly regulate its function. And what happens is the number of positively charged ions in a cell, cations, is always going to be fixed. And if you've got more potassium, if you have a deficiency of potassium, a dietary deficiency of potassium, and a dietary excess of sodium, which is a very typical thing, then you're going to gradually accumulate more sodium inside the cell, and you're dissipating that electrochemical gradient, which is going to make it harder to run the NACA exchanger. And so what's going to happen is your smooth muscle cells of your small arteries, your arterioles, they're going to have a higher cytoplasm concentration of calcium, and that's going to cause them to be contracted for a prolonged amount of time. Prolonged vasoconstriction, contraction of arterioles, causes high blood pressure. So that's the key mechanism to understand. And it's relevant as well that high blood pressure doesn't mean you just have high blood pressure. What it means is you have abnormal electrolyte gradients in all of the cells of your body. So it's a much bigger deal than people realize. And it also will affect function of the brain neurons. For example, in your hippocampus, it'll lead to increased activity of those neurons because of the higher cytoplasm concentrations of calcium. It'll also increase insulin resistance a little bit. So it'll slightly increase one's risk of diabetes as well. Okay, a little more information on sodium. Oh, a tremendous amount of energy is used by cells. You know, a lot of cells are pretty routine to have 25% to 33% of energy being used for the K and ATPase. In neurons, it's more like around 2/3 of the neuron's energy is being used for that K and ATPase, which shows what a big deal it is. If the K and ATPase fails in a neuron, the neuron just dies. So it's a very big deal. So that's something you don't want messed up, the electrochemical gradients in all your neurons. Okay, let's see, what else is interesting here? Oh, another enzyme that's good to know, or a pump, is a sarcoplasm endoplasmic reticulum calcium ATPase. That's called the SERCA. So in a muscle, the calcium can be pumped into what's called the sarcoplasm. The equivalent organelle in other cells is called the endoplasmic reticulum. And this is also powered by ATPase. So it's a sarcoplasm endoplasmic reticulum calcium ATPase, also called the SERCA, SERCA. And there's a lot of things that inhibit this. And so what I'm kind of working towards here is the concept of excital toxicity, which I believe is a major contributor to a decline in cognitive function. There's a very nice book. It's called Calcium Connection. The author's name is Brundy Brody. And basically her son had a calcium metabolism disorder. And she went and contacted all these scientists. She's not a medical person, but she's real bright. And she got them to help her. And they figured out that he had a problem with his SERCA enzyme system. And they were able to do things to help the kid. You know, the kid went from being a floppy baby, you know, ICU, to graduating college with a degree in engineering. So it really saved that kid. And what I'm getting at as far as cognitive decline, I think a lot of adults are sort of nickel and diming themselves into cognitive impairment by they'll have multiple small risk factors, which altogether in aggregate cause them to decline in their cognitive function. So we talked about excessive dietary sodium intake without a compensatory increase in potassium intake will lead to the sodium ions start to replace the potassium ions in the cytoplasm, and then the electrochemical gradient of sodium is dissipated and the knockout exchanger becomes weaker in its ability to pump out the calcium, and you'll have chronic hyperactivity of cells. Again, in the arterial smooth muscle cells, that means chronic contraction, narrowing the arteries, also called vasoconstriction, causing hypertension. In the hippocampal cells, that causes a chronic increase in the neurotransmitter glutamate going across those hippocampus. That hippocampus is the memory center of the brain. So you don't want that overactive for no reason. That can cause anxiety. And also when it's excessive, if you excessively increase the metabolic demands of a neuron, you better have good blood supply of that neuron, because if the neuron constantly has high metabolic demands and can't get the energy it needs to keep up those metabolic demands, that neuron can go into programmed cell death, suicide, called apoptosis, and die, and you lose brain neurons that way. Okay, that plasma membrane electrochemical gradient produced by the K and ATPase is essentially like an electric battery for the cell. The resistance being the plasma membrane itself, the current being the movement of those charged ions. Okay, so we talked about that. Okay, a little bit about stress. The way medical students all remember stress is being chased by a tiger in the dark. So, you know, you're chased by a tiger, you got to get the muscles going and you can shut off the intestinal tract. You don't need to worry about digestion at that moment. The immune system is suppressed during the acute stress being chased by a tiger. The stress system, which primarily elevates cortisol hormone, it elevates the catecholamine hormones, that's epinephrine, norepinephrine, also called adrenaline and noradrenaline, is designed primarily for short-term physical situations, being chased by a tiger, you know, climb a tree or something. But in the modern world, we all have these persistent psychological problems quite often, and the stress response can be rather prolonged. Cortisol is a hormone that it'll increase the kidney's reabsorption of sodium. That's sometimes called a mineralocorticoid effect, but that can raise blood pressure. You know, people taking corticosteroid medications for whatever the reason will tend to get high blood pressure. The cortisol also causes increased glutamate secretion in the hippocampus. Now, you can think of like the Socratic method of questioning, where the instructor, the older mentor figure, asks a question of the student, and the student's a little bit stressed by the question, but a little bit of stress can be a good thing. There's something called the Xerxes-Dodson curve, that as you move up on the stress curve, a little bit of stress is arousal, attention, and that's good. Whereas excessive stress could mean, you know, you're distracted, you're confused, like when somebody chokes in a sport. So basically, a little bit of stress during an interesting activity, that's a good thing. You're energetic, you got high attention, focused. But excessive cortisol, increasing the activation of the hippocampus for no reason, that is not good. And stress can very quickly multiply. Let's say you had some disappointment or argument with a person you care about in the daytime, so you're stressed about that. Then you don't sleep that night. Then the next day you're like, gosh, I didn't sleep. You're still stressed about the whatever disagreement was. And so you go, well, I'll have some coffee to perk me up. But coffee itself raises the same hormone. So from sleep deprivation, emotional distress, and the caffeine, you've now sort of like tripled the stress response. They all increase the stress hormones. The catecholamines, you know, they also will increase blood pressure. They'll help with vasoconstriction of the viscera, like the intestinal tract, which you don't need to be active at that time. Increase blood thickness. Stress is not just an emotional thing. It's very much a physical thing. You know, it keeps us alive during a physical danger, but when it's chronically elevated, it makes us sick. It will increase several things in the blood. Fibrinogen, which is a major clotting factor in the blood, is elevated. Factor VIII, also called antihemophilic factor, is activated in the blood. Von Willebrand factor is activated in the blood, and the platelets themselves become stickier, more activated. All of these things increase the risk of blood clotting, of thrombosis. So, you know, theoretically, if the tiger scratches you, being chased by a tiger in the dark, that'll help prevent you from bleeding out. But it is not a good thing to be prothrombotic on a continuous basis. In addition, the activated platelets are also thought to slightly increase the risk of cancer and cancer metastasis, that they can potentially hide metastatic cancer cells. That's an interesting thing. That's theoretical, but that's out there. Another interesting weird thing about catecholamines, not widely known, is that they also can function as siderophores. Sidero means iron, phore is like transferring something. They can facilitate the transfer of iron to another cell, like a bacteria. So they increase the risk of infection. In addition, cancer, what is cancer? You know, cancer is obviously a complex, multifactorial thing, but in one sense, cancer can be thought of as a differentiated cell, part of a multicellular organism that functions as in an organ, like let's say a liver cell functions as a liver cell. With cancer, let's say due to hypoxia or other reasons, that cancer cell will de-differentiate and become like an anaerobic bacteria. In order to grow an anaerobic bacteria in a cancer cell, they need a lot of iron, okay? Normally the body prevents infections by sequestering iron. It's a common biological mechanism to prevent infection. If you look at an egg, for example, an egg, the egg yolk in the center from a chicken, the egg yolk is where the little baby chick is growing. But the egg white around it, so to speak, is devoid of iron. And that because the shell has to breathe a little bit for gases and stuff to go in and out of the shell. So a bacteria could get through that shell, but they hit the egg white around the yolk and there's no iron in there. They can't go through it. It'd be like a human trying to walk across a 100-mile desert and there's no water. They can't do it. And so what I'm saying is that ability to sequester iron is lost with high catecholamines, which increases the risk of infection when a person is stressed. We've all seen that. And there's some viruses that seem to be able to sense the cortisol level, whereby they'll reactivate like a herpes virus when the person is stressed out with high cortisol levels. So this can explain why excessive stress can sometimes activate different diseases, potentially infections, potentially thrombosis, increase the risk of cancer. So you don't want to stress out a person who might be at risk for these diseases, okay? So that's kind of interesting. Sleep deprivation, we talked about those being stress equivalents. You'll also lose more magnesium in the urine. So you want to try to make sure your magnesium is not too low. Magnesium is right in the center of chlorophyll. So something like green leafy, have a salad to help to replace it. Now, you know, we're talking about dementia and cognitive impairment, and I'm going to share with you something that I think is fantastic stuff. The dilatory vascular hypothesis of dementia. And I had the experience where I believe that dilatory is right. I actually kind of figured out analogous on my own because I look at tons of brains. And a lot of times I got the old brain from 15, 20 years ago. And you'll read stuff like, oh, Alzheimer's disease, you know, especially atrophy within the medial temporal lobe and perhaps the parietal a little bit. But you know what? That's not what I usually see. What I usually see is I see an atrophic brain. that's just progressively, slowly, diffusely everywhere, atrophying over the course of the years. A lot of times I'll see more central ischemic areas. They're called watershed infarcts or silent strokes. And they call that central atrophy sometimes. On an MRI report, it'll be described as periventricular hyperintensity. It just means these bright spots of damaged brain tissue. But the main thing by far I see is an atrophic brain. And so if you have a stroke, that means you completely block an artery and the brain tissue supply by that, it's all dead. And it dies quickly. There's no oxygen to maintain the K and ATPase, plasma membrane gradients. So the plasma membrane loses its integrity and the inner contents of the cell, they spill out. You get edema. And you can quickly get an inflammatory reaction to it from the microglia of the brain, the inflammatory cells of the brain, the immune system of the brain. So what I'm saying is I can point to a stroke like that. The patient just had a stroke in the left parietal lobe. All right. But it's not like that with these demented patients. I just see a brain slowly shrinking. So I'd ask myself, why are these brains shrinking? What's happening? And I figured out it has to be apoptosis. Apoptosis means that the neurons go into cell death when they can't get enough oxygen or glucose to survive. And you go, well, whoop-de-doo, what does that matter? Well, it's good to know. So you don't want to do things that are potentially going to put you into cerebral hypoperfusion and apoptosis. But Ldl Cholesterol, that's the name of a researcher. His name is Jack Ldl Cholesterol. He actually wrote a great book called Alzheimer's Turning Point. And what he was doing in his lab is he would take mice and he would tie off the carotid artery. So he ties a suture around the carotid artery in the mouse's neck. And then he finds out that the mouse would typically start becoming demented. It didn't happen right away usually. A couple months later, about 2 months later, the mouse is no longer behaving like a normal mouse. It's just become a demented, stupid mouse, all right? And so he said, well, gee, I wonder what's going on. So then they would do autopsy on the mouse, look at the mouse brain. And most of the time they weren't seeing a stroke. They were seeing an atrophic brain. And this is consistent with apoptosis. And I thought that was really fascinating because now you get into the concept of what are the mouse equivalents? Well, gosh, there's lots of things in humans that are just like the mouse. Atrial fibrillation. Everybody learns in medical school residency, AFib. Yeah, I know how that causes dementia. You form a clot in the atrial appendage, and then you toss a clot up to the brain. It's called a cerebral embolus, and then they have a stroke, and that's why AFib patients have a higher risk of dementia. It is true that atrial fibrillation is one of the most common causes of stroke, but there's another major reason why these AFib patients get demented. It's because they lose the atrial filling to the left ventricle to pump more blood up to the brain, and that loss of atrial filling means that they're getting less blood to the brain. So they can have chronic cerebral hypoperfusion, especially if their rate's too fast. That means they're going to have if their heart rate is too fast, they're even more predisposed to inadequate filling of the left ventricle. With the left ventricle, stroke volume is how much blood gets pumped out of the heart. And when that is progressively, chronically diminished, the brain's not getting enough blood. So it's like the mouse. Congestive heart failure. You've got poor pumping from the heart, quite often from chronic coronary artery ischemia. For other things can do it as well, but that's the more common reason. CHF is super common. Chronic underperfusion of the brain, end up like the mouse, demented prematurely. Excuse me. Obstructive sleep apnea. This is a secret killer. A lot of people don't know about this. I've seen people in their 30s becoming demented from this. And as obesity becomes more and more common in this country, more and more patients are having obstructive sleep apnea. So what happens with obstructive sleep apnea? The person stops breathing. So apnea means to stop, and then sleep apnea. While they're sleeping, they'll stop breathing. And the reason we know about this is a lot of patients nowadays go to pulmonology and they have a sleep study. And it's kind of funny, I know some pulmonologists, I'm friends with some of them, and I teased them one time about being a bunch of chumps. I said, yeah, you guys are a bunch of chumps. Nobody smokes cigarettes anymore. You guys are going to have no patients. You might as well retire. Just joking around, And then I realized, oh no, they've got this whole new tremendous clientele, all these fat sleep apnea patients. And like they were doing fellowships in sleep. I'm like, why would you do a fellowship in sleep? I could learn everything I wanted to know about sleep just reading on a weekend. You're going to do a 1-year fellowship of your life? The reason they're doing it is it's a big thing in pulmonary medicine. They follow the patient overnight to see if they're dropping their oxygen saturations, these sleep apnea patients. And then if they're dropping their sats, they'll give them this max called a CPAP, continuous positive airway pressure. And the sleep apnea patients do better when they get their CPAP. They would also do well from learning about nutrition and losing weight. And another weird thing about sleep apnea, they go, oh, obstructive sleep apnea, the big O in front of the SA in sleep apnea. And I'm like, I'm not so sure if that's bogus. And I'll tell you why. I'm a neuroradiologist. I look at the oral pharynx and the nasal pharynx every day, all day long. And we never see anything in the sleep apnea patients. Now, other people tell me, oh no, well, there's papers and I've seen the papers Are these subtle differences they can measure on a sagittal image that the airway is a little narrow? I don't know. Those airways, a lot of them look pretty good to me in these sleep apnea patients. And why am I getting at this? I think, and I realize there's two categories. They'll say there's a central sleep apnea, and then there's an obstructive peripheral apnea. And what I'm basically saying, I think some of it might be a neuropathy related to diabetes and prediabetes. And that's not a definitive thing, but I'm just letting you know, I don't see much obstruction in these airways, and I look at them every day. And I realize it's different in kids. Now, kids have a tendency to get big tonsils, big adenoids and whatnot, and sometimes kids end up needing to go for a tonsillectomy. That's a whole other category of patients. But anyways, be that as it may, what I'm getting at is these patients, I had a guy in his 30s just recently, he's dropping his oxygen saturation into the 60s overnight from obstructive sleep apnea. So a lot of these patients, they're much, much sicker than they realize. And you start superimposing these conditions. Let's say the guy's diabetic. Another thing is these diabetics nowadays, they got continuous. So we know about the sleep apnea patients because we got sleep studies measuring their pulse ox, oxygen sensor on their finger all night. But now we also know about these diabetics. You can put a continuous glucose monitor. They can stick one right to their abdomen and they can check their blood glucose. They used to just stick their finger, a couple times a day, 3 times a day. They had no idea what the sugar was at night. They just guessed what it was. But now they're finding some of these diabetics are dropping their sugars pretty low at night. So they're hypoglycemic. Their brain's underperfused. They're like the mouse. Okay, so you get the same patient. They got sleep apnea and they're diabetic. They're hypoglycemic from the diabetes. They gave themselves too much insulin and they're hypoxic from the sleep apnea. Their neurons are kind of screwed. Okay, and then you superimpose on that. Let's say the patient's eating a lot of MSG. They've increased the metabolic rate of that neuron and they're drinking a diet soda pop with aspartame in it. They're maybe increasing the metabolic demands for that reason. Then there's a lot of salt in their food, so they're vasoconstricting those arteries. Lots of fructose and the effects that has with the uric acid elevation and whatnot, which is a bridging molecule predisposing to rouleau formation. They're creating, the so-called perfect storm, if you will, for cerebral ischemia, cerebral hypoperfusion. And if they do this on a habitual basis, they're losing neurons every night and eventually they're cognitively impaired. Okay, and there's a lot of other things that'll do it. Let's say you're in hypertension. The way I look at a hypertensive patient, they're between a rock and a hard place. If their blood pressure goes too high, they can have an intracranial bleed. It can burst a small vessel, they'll bleed into the brain. That's very rare though. We hardly ever see those. We do see them, but they're really rare. More commonly, we get these little tiny bleeds called cerebral microbleeds from hypertension now, and I've seen those cause dementia for guys in their 40s. Usually you see them when the patients are older. And by the way, you might have heard of cerebral amyloid angiopathy, and that's claimed to be part of Alzheimer's and a totally different thing than hypertension. No, it's not. And I can tell you that because I've seen tons of cases. And it's routine that there's no clear-cut differentiation between a hypertensive encephalopathy and a cerebral amyloid pattern in the brain of microbleeds. So what I'm basically saying is they're all along a spectrum. And the same patients that got hypertensive retinopathy with bleeds into their eye are also predisposed to having hypertensive brain hemorrhages, hypertensive to having cerebral amyloid angiopathy. Okay, so what I would do is I would try to control hypertension so one doesn't end up with any of those conditions. So what else? And but here's the other catch with hypertension: if you overtreat it, you're potentially ending up like the mouse. So if you bring their blood pressure down too low, while other risk factors have not been addressed, you could have chronic cerebral hypoperfusion to their brain, and that can predispose them to dementia. It's not good. Most common risk factor for strokes and for cognitive impairment and for silent strokes in the brain is hypertension. Hypertension is a big deal. It's not just like some minor joke. A lot of people think, oh, my hypertension is under control. And again, like I said, hypertension is a symptom of abnormal electrolyte metabolism across these plasma membranes. And in my opinion, they're not just having a little high blood pressure. Every cell in their body has abnormal electrolytes across its plasma membrane, and that's bad. Carotid stenosis, meaning carotid atherosclerosis, can diminish blood supply to the brain. That'll also contribute to it. A lot of people have aortic valve disease. Aortic stenosis is a tight, narrow valve. Regurgitation is a loose valve where the blood flow is going backwards through it. And these can lead to underperfusing of the brain. Another thing too is you got to be careful with coronary artery bypass graft surgery, open heart surgery for a coronary artery where they put a bypass to reroute the blood flow. Because my dad ended up going for that surgery. And, whenever a family member has to have a big surgery or something, another family member should be with them, sleep with them in that room in the hospital, because all kinds of weird little things happen in the middle of the night and you want to be there. All right. And so my dad, what I noticed was my dad was a pretty healthy guy. He was a physician. And you saw a picture of him earlier. He got 74 years old when he went for cabbage. And, he should have been more careful with his risk factors. That's another story. But I'm in the room with him post-op and they're running his blood pressure so low. I forget exactly what it was. Maybe it was around 90/60, 85/60, something like that. So I spoke to the anesthesiologist. I said, why are you running this pressure so low? And they're like, well, we're afraid we don't want him to bleed out of his anastomosis, where they put in the bypass graft to his coronaries. And the point I'm making, my dad was a pretty healthy guy. He came out of it fine. But you can imagine if somebody had baseline carotid stenosis or cerebrovascular atherosclerosis, and they were run, post-op hypotensive, they're at increased risk for a stroke or cognitive impairment. Okay. Severe anemia, that can do it as well. Let's see what else is interesting here. We talked about things that'll increase the demand. If there's stress causes increased glutamate across that synapse, sleep deprivation, caffeine. And so that's what I'm getting at, is a person who's got high metabolic demands, abnormally raised, but diminished blood supply to their brain, they're at high risk to become demented. I call these mouse equivalents. And this is called excitotoxicity. It's super important. And you won't find much about this in the standard books. I own these books that are 1,700 pages long on neurology, and there'll be like one paragraph on excitotoxicity and it'll just be under the stroke chapter, which is ridiculous. This is big stuff, and this is a major cause of cognitive impairment. Okay, all right, I just showed another picture of those gradients. We just talked about that. Potentiators of excitotoxicity. We talked about this, all these SERCA inhibitors. That's what's good thing about that book, Calcium Connections. They go through all these SERCA inhibitors. And basically, you can think about, having a nose. God gave you a nose for a reason. If something smells bad, get away from it. Be careful with all these cleaning chemicals. A lot of them are toxic. These paints and these glues, get away from it. It's not good for you. The bleach, you don't want to be smelling all these stuff. These things potentially have a neurotoxic effect. And I see a lot of people that are just oblivious to working with chemicals, and they just, no, if you're going to have to work, if sometimes you have to work with a chemical, open the door to the room, ventilate the place, and in processed food, some of these preservatives, they'll have a bit of a negative effect on the SERCA enzyme. These are some common preservatives, common food dyes, some herbicides and pesticides. So what I'm saying is a lot of people I won't even go to the dry cleaner anymore. That place smells and all the chemicals in there. No way. I'll just do my own shirts. I don't care if there's wrinkles. I don't care. So I'm just telling you, these are some of the ways you protect your brain health. A lot of this other stuff, we already talked about it. Oh, here's just a picture of magnesium, the role it plays with its positive charge to help hold the phosphates together on an ATP. And magnesium is a big deal because you need magnesium anywhere you've got an ATP utilizing reaction, because you got to hold these phosphates in place. So if a person is deficient in magnesium, which a lot of people are, they're at increased risk to have problems with their sodium and calcium metabolism. You don't want that. And I also think this is why somebody who's got excessive excitotoxicity risk factors, they can also manifest with poor moods, anxiety, for example. And this can also be related to headaches and migraines. I mean, there's obviously more to it than that. Magnesium is called the mellow out electrolyte. In comparison with calcium is a contraction, make things happen. Magnesium is almost the cool things off. Magnesium actually blocks the receptor for glutamate in the brain and hippocampal cells. It sits right there in the middle of the NMDA receptor, which is the most important receptor for glutamate, the excitatory neurotransmitter. About 80% of the neurotransmitter in your brain, depending on what you read, are glutamate. It's an excitatory neurotransmitter, and magnesium helps block that. When magnesium levels are low, you can get increased amount of stimulation of that. Let's see what else is interesting here. We talked about the concentration gradients for potassium, sodium, and calcium. Magnesium is right in the center of chlorophyll. So that's why I always eat a salad every day. I try to eat two. I try to have one with breakfast when I eat breakfast and one with dinner to get that magnesium and other things. Things you can do, we talked about lowering one's dietary sodium and also increasing one's dietary potassium. There's a lot of plant foods, you'll look at blueberries and these other things, they'll have hundreds times more potassium than magnesium. It's the ratio that matters more than anything else. As long as you get a good ratio there, you'll probably be okay. I recommend zero processed foods. I don't like eating stuff out of a can because it tends to have tons of sodium. Also, you got a BPA lining, which is estrogenic, and it tends to have tears in it. And then you get exposure to the aluminum in the can. Aluminum is a bit of a neurotoxin, and it's a bit harmful, I think, to the SERCA. I recommend avoiding all oils. I don't even eat bread anymore because I don't like the oils in it. I can't find a bread that doesn't have oil or MSG in it. I personally recommend no sweets for what that's worth, no caffeine, minimal alcohol or none. I don't drink any, not one drop. talk about control your stress, exercise, get your sleep. Talk about the glial lymphatic system of the brain to clean it. Time management, we already talked about that. Oh, I don't know, I didn't mean that. Why did I copy those slides? Okay, this is just a real quick slide on an amino acid. We'll have a carbon in the center, carboxylic acid on one side, an amino on the other side. That's why it's called amino and acid. A hydrogen on one side of this central carbon, and then the variable chain, side chain, that's the R group. Glutamic acids right here, there's 3 carbons. And so aspartate is really the same thing except one less carbon on the side chain. I call it baby glutamate. And they're both excitatory amino acids, meaning they function as neurotransmitters. So that's a whole other big topic, but there's concern about a potential excitotoxic effect with it. And it often will go under different names and be in a lot of foods. And there's a lot, it's more complicated than that. There's a lot more to it than that, but just being aware of it's worth knowing. Simply avoiding processed foods is good. A little bit real quick here on the appearance of a synapse in the hippocampus of the brain. So here's our hippocampal neuron. The neuron in front, here's a synapse. Synapse is the space between the 2 neurons. So the neuron in front of the synapse is called the presynaptic neuron. The neuron after the synapse is called the postsynaptic neuron. And we talked about the KN ATPase maintaining the gradient in the cell, the electrochemical gradient of sodium. And when that's dissipated, you're less able to pump out calcium. Here's our NACA exchanger, NCX. And when you have accumulation of calcium inside the cell, the presynaptic neuron, you'll get increased glutamate release across this synapse. And this glutamate then is excitatory, meaning that it stimulates the postsynaptic neuron. There's different types of receptors for the glutamate. One's called the AMPA receptor, which is a sodium channel. And then there's the NMDA receptor, which is a calcium channel. So initially the AMPA receptor opens up, starts to let sodium into the cell. The postsynaptic cell becomes depolarized. Its charge becomes more positive. Then the magnesium will move out of the NMDA receptor and calcium comes in and it activates all kinds of things. SERCA is the pump right here, ATPase pump, trying to get the calcium out of the cytoplasm to keep things under control in the postsynaptic neuron. And when you got inhibitors of SERCA, excessive dietary sodium, you can see how calcium can very quickly reach high levels in the cytoplasm. And as a matter of fact, when they get very high, the calcium will damage the postsynaptic neuron and it can activate a cascade of reactions called programmed cell death or apoptosis. And this mechanism of cell death due to excessive cytoplasm calcium is called excitotoxicity. And I think it's a big deal because it's not that well known, but it's a major cause of neuronal death and cognitive impairment. And there's things you can do about it. So that's the good news. Just lower your dietary sodium, manage all the other things we talked about. So I see reason to be optimistic as far as that's concerned. And then we talked about all these mouse equivalents. I thought that was a cool concept for understanding dementia. And believe me, I think about this for years, been trying to understand it. And this puts it all together. I think this is a very useful way to picture dementia. I'm aware of the beta amyloid hypothesis. I also like the work of Douglas Kell. I think Douglas Kell is a pretty cool researcher. He's out of England, and he's the one who wrote papers on the role of iron causing excessive oxidative stress and contributing to neurodegeneration. And he believes it contributes to the mechanism through which prions can function. That's all very interesting. He's got a nice long YouTube video lecture. I think it's called Systems Biology Approach about iron metabolism and its effect on oxidative stress in the brain. And I do think there's some utility to that, but I'm just telling you, this vascular hypothesis explains the vast majority of brains that I look at, and I look at tons of brains. But it's worth knowing about it. It's worth knowing about the iron stuff, and that's a whole other big topic, and checking one's ferritin level if you're worried about that. This is just some things we briefly alluded to this with regard to keeping one's avoiding foods with these potential excitotoxins in them. So I'll avoid all these things. What else I think is important? Well, I got a little more on this slide. Watch out for, like, for example, I won't wear a sunscreen. Number one, there's a whole bunch of estrogenic chemicals in it. Number two, I'm concerned about these nanoparticles. Some people think that titanium dioxide nanoparticles might be SERCA inhibitors. Do I know that for sure? No, I don't. But I don't gain it. If I look at a risk-benefit ratio, if I don't gain anything by something, then I won't use it. For me to get my vitamin D, my sunshine, I go out in the sun for about an hour or so, depending on how hot it is. I get my sunshine, I go back inside. You know, if you're going to be at the beach all day, or if you got a job as a lifeguard or something, you're going to have to use more sunscreen. And that's a separate topic. And believe me, what I think is best is to use the non-nanoparticle sun blockers, like the titanium dioxide that's not nanoparticle, or I use the zinc oxide. That's a whole other subject. And I've made videos about that before at my other spot. But anyways, that's a little bit interesting. Then MSG, it's in almost all the processed food. I would guess it's in at least 90% or more processed foods. That's why I don't eat any of them, other than I told you the rare exception. I'll eat plain oatmeal, one ingredient only. So I know they can't put MSG in it if there's only one ingredient. We talked about most of this. Tobacco is another major cause of brain hypoxia that contributes to the multifactorial effects we were talking about before. Oh, another giant topic. I don't know how much time we're going to go here, but estrogen is a major topic. Estrogen chemistry is fascinating, and it's really easy to learn, and tons of people are getting sick from this, and it contributes to a multitude of disorders because it's transdermally absorbed, and it contributes to weight gain, which contributes then to hypertension, contributes to diabetes. So anyways.
My first question is, I went to see, I'm early 60s, so I went to see a cardiologist to get sort of checked out since my dad died of heart attack. And there's two tests I read about. One is the CAC CT exam, which is a CT exam of your heart. And then there's another one called the CIMT, chorded media thickness test. That's a sonogram. And so this guy had me do the CAC, but I thought going forward, I'm not sure I want to get a CT exam on a regular basis. So I wonder if he could talk about those two tests that help you see how, if there's calcium in your, and build up in your blood vessels.
Yeah. Okay. So I'll give you what my perspective would be. William C. Roberts, the cardiac pathologist. And by the way, you could see his video. He has a YouTube channel, William C. Roberts, just his name. And he's got like a whole bunch of copies. They're like all copies of the same lecture. So you only need to watch one of them. But I think the best version, and I've watched a bunch of them. I like him. I think he's a fantastic pathologist. It's the one called Lifetime Trials. And you watch that about atherosclerosis because it's very informative. And one of the things he says is, if you take a bunch of predominantly herbivore animals and you feed them a very, very high fat diet, they're going to all get atherosclerosis. And I believe that humans are predominantly herbivores. Yes, we're omnivores in the sense we can eat a wide variety of things. But what I'm trying to say is anybody who's eaten a very high fat diet, the average American diet's about 45% fat for several decades of their life, you probably have atherosclerosis. And it's probably a wise assumption just to say, I've got atherosclerosis. And by that, I mean, you know, why expose yourself to a CT and get the radiation dose when you could pretty much make it a safe bet? You already know you got atherosclerosis. It's a safe assumption that you do. Don't get me wrong. Some people, what I've seen though, is they like getting the CT because once they see those calcifications in their coronary arteries, that's sort of like the fuel for their motivation to make them motivated to make all the diet and lifestyle changes that will help them to keep those coronary arteries clean. Okay. I'm very meticulous about how I eat. I can tell you my total cholesterol is 93. The average American has a total cholesterol, depending on what you read, of about 230, 217 to 230. And they actually describe in this country normal cholesterol as being less than 200. But based on the Framingham study, the Esselstyn study, I think it's best to try to keep total cholesterol below 150 because it's been shown persons who can consistently maintain it below 150, they almost never have a myocardial infarction. I even like to try to keep it below 140. But what I'm trying to say is when a person minimizes their dietary lipids, they can reabsorb the lipid within their atherosclerotic plaques. And in addition, the endothelial cells, the arterial lining cells will tend to function better and produce more nitric oxide vasodilator, which will improve flow through those arteries. So that's one way to look at it. The other thing you mentioned too is like carotid intimal medial thickness, and the thicker it is, the higher the risk you are of progressive atherosclerosis. Again, and then you go for, that's done with an ultrasound, so there's no radiation exposure, but still, as far as I'm concerned, you know you got atherosclerosis probably if you've eaten a westernized high-fat diet for many years. So just assume you do and change all your risk factors now. And if you want, get follow-up total cholesterols. That's what I personally would do. And I found that works pretty well for me. I'm 58. I have zero medical problems. I got a lot of energy. I lift weights every weekend. I can walk 50 flights of stairs, barely break a sweat. I'll break a little sweat, but I mean, I'm fine. I breathe a little faster, of course, but I'm fine. I mean, I could keep going up for a lot more. I just if I have more time. So what I'm trying to say is basically look at a list of risk factors for coronary artery atherosclerosis is what I would do, and avoid all of them. You know, you can't avoid the fact that you're a man, you can't avoid the fact of your age, but almost all the other ones you could avoid. And so that's what I'd recommend you do. And also we talked about, I try to eat at least a salad a day, if not two. I really try to eat 2 salads every day. You get those greens, you get that magnesium. I'll try to eat some plant foods, you know, whatever it might be. Try to eat some raw fruits and vegetables every day. They got tons of potassium, all vasodilators, keeping those arteries open. You know, it's good to have a walking habit of walking. If you're already healthy enough, you know, you maybe got to get clearance by your doctor. I don't know how bad your coronaries are, but if you got clearance from your doctor and whatnot, you can walk. Getting some exercise every day helps to build collateral vessels. The body pretty much is a use it or lose it system. It responds to what you do. So if a person's in the habit of walking, they're going to have more collateral vessels along the surface of their heart that help maintain blood flow to the heart. And then also, if you minimize all your atherosclerotic risk factors, you'll have a better chance of keeping those arteries open, and you'll thin your blood and your pressure will be better. But you got to be careful. You got to let your doc know, because when you make dietary changes and lifestyle changes, you can get changes in your medication dosages. So if you're on any medicines for diabetes or high blood pressure, you got to let your doc know and work with them to titrate those down.
You mentioned the salads. So I put a few, you know, how do you eat your salads without oils?
I just eat them plain, no oil. Forget the oil. Forget about oil. Not one drop of oil. There's a very famous doc by the name of Esselstyn. He has the best results of any doctor in the world for coronary artery prevention. And I can tell you, this is his mantra: no oil, not one drop. And I think it's a good mantra, because those oils, they showed back in the 1960s. Some of the researchers on that stuff was Peter Quo, was a cardiologist from Philadelphia. There was also a good team of ophthalmologists. One of them was Meyer Friedman. The other one was Ray Rosenman. And they found when they fed polyunsaturated fats from these oils to these patients, they would get sludging of the bloods. And they put this 80 times microscope right over the person's eye, and they could see the vessels contracting and narrowing and the poor blood flow in real time. And not only that, but it persisted for more than 9 hours, which is almost frightening, longer than any other thing they had the people ingest. You had this prolonged impaired blood flow effect. So if a person's putting oil on their food, you know, they're going to get over 9 hours from that. And if they're having something with oil in it for lunch too, they're going to be spending a lot of their time with very poor blood flow and increasing the risk of arterial thrombosis, risk of hypertension and whatnot. So no oil, not one drop the rest of your life. That's my advice. I'm not allowed to give you advice directly, but I'm just telling you, I won't eat anything if it's got a drop of oil in it.
Do you put anything on the salad just to make
No, I just eat it plain. And I'll tell you what also happens is we've been so conditioned to have all these flavors and sweeteners and stuff that we've gotten away from being our natural selves. I like stuff simple. I mean, like if I want to eat oatmeal, I just boil some water, eat oatmeal plain. I mean, I'll put blueberries on it sometimes or banana sometimes, but other than that, I'm fine. If I want rice, I'll just rinse the rice off. There's the whole arsenic issue, but I'll still eat, you know, organic California rice. And I think it's okay. It's a long story, but I think it is. I'll just, I'll mix that with beans, or I'll mix that with potatoes. Pretty simple stuff. And it makes me happy though. I don't eat any fancy stuff. And when you get away from eating all the fancy stuff, all the fast food, processed food, restaurant food, I think your tastes simplify. I really like the food I eat, and it's fast.
Okay, excellent. You mentioned the stickiness of the blood. Can you comment on aspirin today?
Well, you could do that, but, and you know, that's between you and your doc too. But me personally, I don't take any medicines, none, because aspirin itself can have side effects. It can lead to irritation of the intestinal lining. It can lead to ulceration, you know, increase the risk of peptic ulcerations in the stomach and whatnot. It can also increase the risk of bleeding. I sort of, if you will, thin my blood naturally by eating healthy foods and exercising. I try to do a lot of little things too. I have a standing desk. Whenever I have to go to the bathroom, I always go to the far bathroom. Like, you know, in between my wife and me, okay, you know, you have to negotiate with the wife on who uses what bathroom, right? And she thought she won a big victory over me to get the good bathroom on the ground floor. But guess what? I'm always going upstairs or downstairs, so I'm getting tons of exercise every day, and that's a good thing. So I'm glad it turned out that way.
After everybody else has asked questions, if you could comment on chlorine dioxide, which is off topic.
Well, I'm not that sure about chlorine dioxide in particular, but I do like having a whole house carbon filter to remove the chlorine from my water, because otherwise you're inhaling that. Chronic inhalation and ingestion of chlorine in one's water over time, in the ballpark, I read it doubles your risk of bladder cancer. And I've also heard, you know, it can contribute to having a leaky gut phenomenon in one's intestinal tract, which increases one's risk of autoimmune disease, for example, and generalized systemic inflammation. you don't need the chlorine in there. I mean, it sanitizes the water, preventing bacterial infections. That's a good thing. But once it's in your house, you don't need it.
Okay, I'm going to say one more comment. I could imagine a book from you with a chapter sort of on each of these subtopics you've spoken about, and then the last section of each book then would have some steps on okay, how do you translate all that fantastic knowledge into a couple of like we've got one today, don't eat salads with oil on it. I could imagine a book like that.
Yeah, I've actually written books, but the thing about books is you got to be famous. You know, if you're not famous, no one knows who you are. No one cares. Not me. No one ever knows you exist. So I have actually written some books, and in my own personal opinion, I think they're good. But I almost never sell a book, so no one knows I exist.
Maybe a YouTube them. But the key point here is you give out all the interesting technical knowledge, and then you have a section right after that, which is, okay, so this is how this translates for you in your day-to-day life of do's and don'ts. What was the name of that book? You said you already had the book?
Well, if you had to read one of my books, I'd say the best book to start with would be a book called The Tale of Two Toes in a Hot Tub. And then the subtitle is How to Improve Blood Flow. Because I think the concept of improving blood flow is good for healing all kinds of things. It improves cardiac function, improves brain function, any type of wound you want to heal, improving blood flow. And in addition to, lowering one's dietary sodium, I go through all the other risk factors and whatnot. And that's a real fun book. Anybody could understand that. And then I've written books that progressively go into more detail, but that's sort of the money book for real quick optimizing blood flow and understanding how this nutrition stuff works in atherosclerosis.
Excellent. Thank you.
What's that called?
It's called A Tale of Two Toes in a Hot Tub. That's the title of the book. And then the subtitle of the book is How to Improve Blood Flow. A Tale of Two Toes in a Hot Tub is kind of a joke. It's a spoof on Jonathan Swift had written a book, A Tale of a Tub, that's kind of a parody and kind of funny. And so A Tale of Two Toes in a Hot Tub is about these guys and their girlfriends and going for surgeries and how the two patients respond to all their problems. And it's also something I wrote it to make my doctor friends laugh. There's a whole bunch of jokes about going for surgery and anesthesiology and stuff, like what music to play during the surgery and stuff. And so it's meant to be a real fun book, but it does go through what one can do to optimize blood flow and other things related to improving one's health. So it's, I think it's a lot of fun. My doc buddies who've actually looked at it have enjoyed it. And there's a lot of humor in it. I think you'd be surprised by that, because like when a doctor talks to a patient, they have to be very professional. Versus when I'm joking with my friends, we just try to be funny, try to make each other laugh. And I kind of figured my friends would be the only persons who would look at it. So I wrote it for them. But I think anyone who is in a good mood, wants to have a laugh while they read about health stuff, I think they'll enjoy it.
People,
Might have
if
to
they
scroll
have
to the
blood
top.
pressure too low rather than too high, should they consume more salt?
Well, if they did consume more salt, that would help to increase their blood pressure. They might have to go see a doctor to help manage their blood pressure. But yes, it can be dangerous to have blood pressure too low. A lot of times that comes from overtreatment of hypertension, but it can happen from other things too. You can have an autonomic neuropathy, for example. There's other things that could be doing it. But, if you know that you got really low blood pressure, you got to get that checked out.
On the salt, doesn't it depend on the aldosterone renin level, whether the salt is adversely affecting your high blood pressure?
Yeah, I know that there's the renin aldosterone angiotensin system, but I'm not real sure about all the issues of checking it. I don't have experience with that.
Okay. Somebody asked, and I think you answered that, Louise asked, does that include no olive oil?
So it was interesting you're talking about all the dangers of sodium. I'm in a little bit odd position in that my sodium is really unstable. It went down to 123, and then I actually fainted and broke some bones. So I really struggle to keep up my sodium level, and I'm not sure why what the etiology of all that is, but I find that I have to restrict my fluid intake and up my sodium level. And part of me wonders just what the effect of that is over time. But yeah, so the issue isn't low potassium for me. It's just very low sodium and low chloride, and just struggling to keep that level within range, which it's usually just about 135, 136. I'm lucky if I get it up to 138.
Yeah, I think that's kind of a rare thing, and I don't know exactly how to handle that. But like, what would I recommend you do? What I would recommend you do is read a lot about how sodium works and how it's absorbed. I would recommend this book, High Blood Pressure Solution by Richard Moore, MD. He's an MD PhD who devoted his whole life to researching sodium, because you'll learn a lot about how sodium works in the human body. That might give you useful insights. I can't guarantee it will, but I think it might help you. Perhaps eating a wide variety of foods. The intestinal tract is like a genius. I mean, imagine if you had to figure out for yourself how much you're going to absorb of each individual nutrient, sodium, potassium, calcium, iron, and everything else. You'd go crazy. It'd be way too complicated, but the gut knows what to do. So maybe just making sure you're giving the gut a variety of foods. I don't know what you eat. I have no idea, of course, but maybe that would help, but I don't know how to answer beyond that. I would just become an expert on sodium metabolism, though, in every way, and the things that affect it.
Yeah. I mean, I know I've got some real low cortisol, low ACTH, low renin, going, so low aldosterone. So that probably is affecting it. What was the name of that book?
Oh, about this particular book? This book is called The High Blood Pressure Solution. And the guy who wrote it is Richard Moore. He's an MD PhD. And I can tell you, this guy's brilliant. And like I said, I think he's dead now. I tried contacting him. He did his PhD, I think, back around late 1950s. But the guy's brilliant. I read tons of books, and it's a magnificent book. And what it'll do is it spends tons of time going through all these subtle details about the plasma membrane potassium sodium pumps, and about all the things that are connected. For example, when you get high intracellular calcium, you start getting increased insulin resistance. And he'll go through all these subtle physiology connections. And I think that'll help you, because it'd be good for you to become an expert on understanding all the nuance of sodium metabolism, because that might help you on, how to manage your own hormones. I mean, yeah. So I that's about the best I could tell you on that.
And that's the book that you used for talking to us in your talk today. Is that
it did help me, yeah, because I read a lot of books, and most of the time I kind of know the subject better than the author does. And then once in a while I come across a book like this, which is just, a game changer. It's gave me phenomenal insight, because I have to deal with issues around excitotoxicity, and I would have one piece of the puzzle, so to speak. But once I read his book, it really helped me to understand all kinds of issues with, cognitive function and excitotoxicity. Because a lot of times I'm kind of the guy that explains stuff to these other doctors who are friends of mine that are interested in the brain. And all I can tell you, this is a landmark book. I mean, I've got books, I read tons of books, and the books that are really special to me, I keep them all in one room near where I change my clothes. That's my special personal important library. It's right in there. It's got a key spot, versus all these other books, I just put them on the shelf far away. I'm not going to go back to them. But this book, I go back to it a lot.
But Kumar asked, in one of the slides you showed about calcification in the artery, he asked, what causes the calcification?
Well, calcification is sort of an end stage component of atherosclerosis. And a great paper is the one by William C. Roberts. And by the way, his lectures online pretty much summarize his paper, where he summarized about 2,000 autopsies of patients who had died from coronary artery disease. And what he basically said, and I've seen this in my own experience because I look at tons of CT angiograms, and basically it's a late phase in atherosclerosis. And I believe what happens is that atherosclerosis primarily begins as a blood clot. And then just like if you get a hematoma elsewhere in the body, the immune system comes in and it tries to reabsorb the hematoma. The immune system tries to reabsorb the blood clot. There's an ongoing steady state thing of new clot formation and clot reabsorption happening in there. But eventually the immune system reabsorbs everything it can. And then the remainder, you get this calcified scar. That's a common thing to see all over the body, is a calcified residual scar. And the way I view it is a calcified atherosclerotic plaque tends to be an old stable plaque. It is less likely to embolize versus a big blood clot. That's more what we call a soft atherosclerotic plaque. And there's a little more fear that a piece of that could break off and embolize distally and cause a heart attack in the heart, or a stroke if it's in the carotid going up to the brain. So that's sort of our main concern. And, it can affect technical things. If you're going to stent the artery, it might be a little more difficult to expand it with a calcification. Calcified artery is less likely to dissect. But I mostly think of it as sort of a mature chronic atherosclerotic plaque. they see that on the coronary artery calcium CT scans. And there's a little bit of an increased risk of all-cause mortality if you got a lot of calcification in your coronary arteries. An aorta that's all calcified has lost its elastic fibers, so it's less able to maintain diastolic flow. So that's pretty much how I look at it.
We have another question about brewer's yeast. Is that a good supplement?
I don't know. The only thing I can say is make sure it's not, doesn't have significant MSG in it. A lot of things with the word yeast in them have MSG in them. I have one slide. I kind of went through the slide quickly, but, and I certainly know I didn't write brewer's yeast in there, but I do know there's a lot of different books about MSG if anybody's interested in it. And you can see there's also a lady who's quite interesting. Her name is Kathleen Reed. She's a PhD biochemist, and her daughter had autism. I thought that was rather clever, and she went through issues about MSG. So for what it's worth, I would just make sure if you're taking it, you don't want to be ingesting MSG for no reason. So make sure it's not in there. Maybe it is, maybe it isn't. I don't know. I personally, I don't supplement with anything except vitamin B12. You know, I take a vitamin B12, but that's it.
Well, Candor came through with this question, and it's concerning low blood pressure, prone to have pre-syncopal spells. So is there any risk of atherosclerosis having such low blood pressure, or would the risk be primarily dementia due to the insufficient blood flow to the brain? And what about strokes? What was the reference to the mouse experiment on dementia? The low blood pressure is not from treating hypertension in his case.
Yeah, well, with low blood pressure, yeah, I'd be worried about ending up like the mouse having cerebral hypoperfusion. So I would try to understand what was causing the low blood pressure. So I would spend a lot of time trying to get that figured out. Because also, you know, if you have low blood pressure while you're driving a car, you could get in a car crash. If you have low blood pressure while you're walking down the stairs, you could fall down the stairs. So you want to try to get that figured out as best you can and see if there's things you could do. Maybe there's something you could do related to your diet, related to, you know, you eat something, maybe you should eat something a little salty if you want to get your pressure up during a certain time of the day. So that's kind of how I would look at that.
We have two more questions. What causes a clot to become calcified? And the second question is, do you recommend people over 60 to ask for a CAT scan of heart arteries to see how much calcification there is?
Okay, well, the first question is, why does a clot calcify? And it just tends to be the end stage of a scar. For example, anytime a person has bleeding, let's say they bleed into a muscle, into their arm, the immune system comes in and it tries to reabsorb all the useful biochemical molecules and recycle them to other parts of the body. It also has to clean up the mess because the hematoma, which just means like a big blood clot, it could interfere with the muscle function, contracting the bicep muscle, for example. So wherever there's a blood clot, the immune system comes in and tries to clean it up and recycle it. That happens everywhere in the body. So atherosclerosis begins as a blood clot. That's called the Atherothrombosis theory of atherosclerosis, which is a whole other subject, but believe me, after spending years studying it, that's the best explanatory thing. And it's a giant way to look at atherosclerosis. Everything else fits into that as a subset, cholesterol theory and all the other theories of atherosclerosis. Okay, so what I'm basically saying is anytime you get a scar in your body, it's very often that it'll calcify. I see calcifications in the brain all the time, especially in the basal ganglia, for example. So I just think it's a natural process of the immune system cleaning something up and leaving a calcium scar, but it's not a good thing. You know, when something's calcified, that organ's less functional than it was before. The aorta calcifies and now it's stiff instead of being a dynamic structure, the ascending thoracic aorta that's functioning like a second heart. When it's all calcified, it's basically like a stiff pipe and it's lost its elastic recall during diastole, so it's less able to produce diastolic blood flow. So you'll see these wider pulse pressures between systolic pressure and diastolic pressure as a person gets a calcified aorta, and they'll have a high systolic pressure and a low diastolic pressure. That's very characteristic of persons with a lot of atherosclerosis on a chronic basis. So that just is something that happens. Then as far as the cardiac calcium scanning CT, my attitude is that I already know that if you've been eating a high-fat diet, you've got atherosclerosis. A cardiac CT, I forget the exact amount. I recall off the top of my head something like 20,000 chest X-rays. And it's sort of like, why sit through 20,000 chest X-rays when you already know you got atherosclerosis? What's it going to tell you? And it's been my experience that persons who haven't studied atherosclerosis as much they see that CAT scan and they're like, you know, oh my goodness, I've got calcified coronary arteries. I've got to change my life. No more, you know, whatever bad habit of their atherosclerosis risk factors. They'll stop putting oil on their salad. Okay. You know, I'm kind of joking, but you see my point is they need to see that CAT scan to get motivated, because to a lot of people, all this discussion of it just doesn't move them to change their behavior. Versus, I would say for myself, if I see a total cholesterol that's above 150, that would make me nervous, and that would be enough of a motivator. So what I'm basically saying is, why expose yourself to the radiation if you already know you probably have atherosclerosis? And you really should, I would just focus on minimizing one's risk factors rather than getting a CAT scan to tell you what you already know.
Well, I want to thank you, Dr. Rogers, for coming on the show. We look forward to having you back because you have a wealth of information that we love. And so thank you very much.
Oh, well, it was my pleasure. Thank you very much for having me.
Okay.